Should we be allowed to drive drunk if we don't hit anybody?
Oh, I got the same example again.
That's not a. I mean, there's laws against.
I'm not
drunk
asking. I'm asking,
driving.
should there be laws against driving drunk if you're not hurting anybody? 'Cause technically, driving drunk is your own personal decision. As long as you don't get an accident, should it be illegal to drive drunk?
That's against traffic law.
I'm not asking
Yeah,
about the law. If there was a law for mandates right now, you wouldn't be in favor of it. So I'm asking you, should it be illegal to drive drunk? If you're not hurting anybody, you just drive drunk in your own car, so you don't get in an accident, why should that be illegal? How is it that every single country, company, and academic institution in the world can come together on this conspiracy theory?
Single one? What about everyone else that's being censored?
A doctor, a single person, is not a country, company, or institution, like a university.
A lot of people that are.
A lot of people is not a country, a company, or an academic institution. Do you understand that?
So I guess I'm gonna ask a few of you guys. I mean, I'm pretty sure everyone already knows, like people like Destiny, he's vaccinated. Jeff is vaccinated. I'm not, but anyway, we're gonna start asking some people. So for one, let's go ahead and start with Geisha Montez. Are you vaccinated?
No.
You're not vaccinated?
No.
Okay.
I don't know the Ninja song, guys.
Provide
I'm
some
sorry.
information as to why you decided not to be vaccinated?
It was when things started to not add up to me, when I started researching, seeing, and a lot of things about the deals that were made with the countries, the deals between the pharmaceutical company and the governments, and also I did research on what are the potential ingredients on the vaccination itself, and then also I researched on the VAERS and see the amount of side effects, and the possibility are way higher of having a side effect or something due to the vaccination than a 99.9% chances of you surviving a cold or a flu, or however they want to call SARS-CoV-2, which is the also known as the coronavirus, which we have a lot of different types of coronavirus in our bodies. And just, something that was also put out under a certain emergency, use authorization, and then also all the trials and the legal situation between what happened in the laboratory in Wuhan, what happened with Fauci and the emails, the lies, and like all of that stuff really added up. And then this pressure of government politicians to try to coerce people to a point where they will lose their even how to feed their families, and like how they will lose everything they fought for, whether it's their career or their jobs. And everything doesn't add up when you know that this is not the worst case scenario in life in terms of like what things we fight against, in terms of like illness and issues, and even people passing out for drug addiction or for all other diseases. Me as a Dominican, I know that dengue or the mosquito disease is even worse than COVID, like by a million times, and no one is even paying any attention to that or making much of a deal. And I just got to the point of, I could talk about that for a long time, but to me it's very much about controlling. And then if we know now by now that they haven't stopped any spread, or they haven't.
What are we
really
talking
made
about
anything
right now?
better,
What is
like,
happening?
Pushing the people to have a fourth one, now a fifth. After that, it's going to be a fifth. And I just, for me, a lot of the things didn't make a lot of sense. And I feel like the best thing for me, and I trust my my natural immunity, and I think the body has a lot of potential to heal itself from something like a cold or a flu.
Okay, I think that's as perfect an opener as I could have ever heard. We'll get into more of that. I think at this point we should just open the floor now. Does anyone have any sort of response or pushback to any of the things that were stated there?
It's a lot.
Is there background noise? What's happening? Oh, it's fine. It's fine. Anyone have any responses to that?
I mean, there's plenty. I don't know if do you want to get into that right away? Because I feel like once you open the floor to like debating or contesting any of her points, we're gonna be Are we still doing intros? Is kind of my question. I don't know.
No, so I wanted
We're just
to,
jumping into it. No more intros.
We're jumping straight into it. I didn't want to do like lengthy intros for everyone because I think most people, you'll find out what their positions are like midway through. And if you really feel like you do need to really plainly state it, then you can do so in the course of the conversation.
This is going to be.
We're going to get around to everyone. So just you guys can start now.
I don't think there's anything wrong with governments making deals with pharmaceutical companies to incentivize the creation of drugs. We already do that in the United States with the orphan drug program. There's nothing wrong with that. If we think that there's something bad going on there, you kind of have to show something extra than just the government is making a deal with a company to produce a drug, especially when that drug is being produced in different labs all over the world, and especially when governments all over the world are using the drug. It seems kind of weird to just say that like the United States, along with one company, is creating some drug that might be a bad drug. Anytime somebody harkens to natural immunity or says that they have confidence in their natural immunity, I think that's a very intelligent thing to say. We should all have confidence in our natural immunity. That's why we get vaccinated. It's not an argument against vaccinations. It's a huge argument in favor of vaccinations because our natural immunity is so good. We should be training it as much as possible without having to actually be infected with viruses that can cause harm to ourselves or other people. I don't remember what other talking points there were, but yeah, I've heard them all. So
it's a slippery slope about if we allow a booster this year, it's going to just continue to perpetuate further and further, as if like it's not an ongoing pandemic and the virus does not mutate and get intelligent, and that we are learning as we go here. It's not like a very well understood virus that has been around for centuries or anything like that, or even
Trihex. Let me ask this. Do you believe, because I felt like in the very beginning of the pandemic that when vaccines were first introduced, there was this talk, like some people were saying that we would probably be in a cycle of constantly taking boosters, and that stuff was kind of seen as conspiratorial at one point. But I guess nowadays it seems like it is pretty obvious that we are going to be taking more and more boosters, at least for a while, until we do figure out something, if not forever, right? So do you think that there is like at least that there is some sort of validation to the people who were skeptical about like the long-term effect of the vaccines, and now recognizing that these boosters and things are going to be pretty regular?
Well, I don't see why the normalization of like an annual check-in. We already did this with the flu shot, do we not? So I feel like that's like why is the standard tolerable on flu shot, but then suddenly not on vaccine, or at least in terms of COVID. But we can go further than that, but I would just start there with like, why is there even the bias on the perspective? But I guess if you want me to give a more elaborative than that, you're asking me, am I concerned with the possibility of there being the annual booster? Is that was your concern?
Not necessarily you, but that there were people who originally were vaccine hesitant, who were specifically saying that this was something that might happen regularly, and now we're starting to see that the efficacy, it seems like it drops down around 5 or 6 months, so it seems like this will be a regular thing. So then at one point, people were called conspiracy theorists for saying like this would be the regular, and now it seems like this is actually the norm.
Well, I don't want to use like dirty words here, but if you look at it like in a spectrum, whether it be like a full-blown COVID denial versus anti-vaccine versus vaccine hesitant versus like vaccine, skeptic. It depends on the scale you're on there, but depending how high you are on that extreme like fringe would determine like the more things you're going to try to reinforce in your worldview that, oh yeah, they want me to get it, or oh yeah, of course it's going to solve everything. I just get the booster and I get the vaccine and I get 2 shots of it and everything else here. It's what they want me to do because I'm a puppet to them. You can get conspiratorial and ultimately like push yourself further and further off the cliff to where, yeah, you can make everything reinforce your worldview if it's a predetermined conclusion. So that it depends on where they stand to me at that time versus now.
I think it's a little. I think it's a little hard to compare the COVID vaccines to something like the flu vaccine, because the COVID vaccines were rushed to market, right? And there's a good reason for that to happen, but the reality is there were no stage 4 clinical trials that were completed when these were put out to market. Some of them now have those trials completed. I think the Pfizer vaccine does. It's fully approved by the FDA. But even those clinical trials are, there's questions about how useful they are because the people that were in them were informed that they were being given placebos, and others had already been vaccinated by the time that they moved into stage 4. And secondly, I think that given that there are unanswered questions about the vaccine, right, I think and the boosters that I think we need to be honest about, not just about how effective they are, but about the side effects, right? Because these trials have not been completed and they're still ongoing, and our understanding of this virus is still evolving. I think it's reasonable for somebody to look at that, right? Look at contradictory information that we're getting from medical professionals today, contradictory statements that were made by Fauci in the past versus what's being said today, versus studies that are coming out today, like the Caltech study that says that there's no significant difference in viral load in the upper respiratory tract of unvaccinated people versus vaccinated people. Fauci went out and contradicted that very recently, right? And that statement contradicts something he said prior, because it's like 3 or 4 months ago he said that exact thing. So I think it's reasonable for somebody to take all this contradictory information, take the fact that we're still doing studies, there's still a lot of unanswered questions, and to say that, hey, I'm going to make the informed decision not to get the booster, not to get the vaccine.
I think that it's really important that when we use these phrases, I think we have to not load them in other ways. So like when we say things like there's lots of unanswered questions, there's a whole bunch of unanswered questions about side effects, that's just absolutely not true. Could there be some incredibly esoteric problem with this vaccine that has never occurred in the history of any other vaccine before, which would be seeing severe side effects past 2 months? I mean, I guess it's theoretically possible. You'd be dishonest to say otherwise, but like the chances of this happening are infinitesimal. It's very, 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 very small. Or my understanding is there's never been a vaccine with like side effects really past 2 months. So the idea that there's all these unanswered questions when we're talking about a vaccine that's been administered to more people than any other vaccine in human history is just absolutely not true. I don't like the phrase rushed to market when it comes to the vaccine either. I mean, we can say that there wasn't a process that the FDA went through for emergency use authorization, but rush to market makes it sound like it was just haphazardly thrown together and then injected into people's veins. There was a process by which they went through with the FDA. There was a process by which the vaccine was authorized early on before phase 3 trials completed, but like there was a process that went through. I think rush to market is a pretty loaded phase in terms of that. In terms of talking about no significant difference in viral load between vaccinated and unvaccinated people, my understanding is I think there was one preprint that said that there was a similar viral load, but I think that the majority of the research that's come out has shown that there is a lesser viral load and there is a smaller chance of being infected and there is a smaller chance in carrying a large viral load for a long period of time. So even at the apex of your viral load between being vaccinated and unvaccinated, you're less likely to have that high of a viral load for as long if you are vaccinated versus unvaccinated. There are very weird number games we can play to try to say that it's just as bad in terms of viral load when you're vaccinated or unvaccinated, but the facts are that if you are vaccinated, you are going to be shedding the virus for a smaller period of time. You're going to have less serious side effects. The chance of being infected with someone is probably lower if you're vaccinated versus unvaccinated, or if you've been infected versus haven't been infected and are unvaccinated. Also, Fauci contradicting things is never an argument in favor or not in favor of anything. Half the contradictions that people bring up are just the information changing as it comes out. If you want to make an intelligent or an informed decision on something, then basing that on Fauci contradicting himself is probably the dumbest thing you can possibly do. Just look at where the research is, look at what every single country is doing, and you can kind of follow those guidelines there instead of like desperately harping on every single thing Fauci says to try to find one contradiction between what he said now versus in 2020 in April or something.
But what about saying, lying in Congress? Something as serious as that, where when it comes to like where if they funded or not the gain of function in the Wuhan laboratory.
Whether or not gain of function research was funded has literally nothing to do with any of the conversations we're talking about related to the vaccines now. That's a matter between Fauci and the congressional hearing. I don't know if that's being phrased correctly also in terms of him lying about that or that gain of function research. If he did lie, were the charges? If there are no charges, why wouldn't at least Republicans press charges against him? Doesn't seem to be the case. But even if that was the case, how does that relate?
Giving to people all the things that they need to follow. Like, so,
the information doesn't come from Fauci. He alone isn't making these decisions, right? It's not just him making the decisions.
Yeah, and to be clear, I don't mean to imply that they've just rushed some Frankenstein vaccine out to the public. And when I say that they rush it, I mean compared to other vaccines. I think, as far as I'm aware, the fastest vaccine that's gotten to market was a measles vaccine that did complete stage 4 clinical trials, and that took 5 years. Right. So when I say rush to market, I just mean it got to the market at a much greater pace than any other vaccine that we have. And I think that when I speak about conflicting studies and Fauci's conflicting statements, I'm not saying that Fauci fucking up once, or maybe he didn't even fuck up. Maybe the new statements are a result of the studies that he was aware of at the time he was making the statement. Right. So he wasn't lying. He wasn't hiding anything. He was just not aware of a certain study, or he was aware of another study that I'm not aware of, or whatever it is, right? But I think that as a member of the public, looking to the health professionals that are being put forward by our politicians and the media, and you look into the things they say. If you find these conflicting statements, and you find that things they're saying now don't match what they said 2 months ago, or things they said 2 months ago don't match what they're saying now, then I think that I think it's reasonable for that person to make an informed decision not to get the vaccine, right? Especially given that we talked about some of the untested side effects of the unanswered question. We're getting false positives on mammograms. We don't know why. False positives on prostate exams. We don't know why. There are unanswered questions as to the ACE2 receptors and how different those are affected in different groups of people. We don't know anything about that. We need to do pathogen priming. For that, we need clinical trials to answer those questions. Right? So there are unanswered questions here. The science is not settled. It is evolving. Right? And I say that as someone who made the decision to get vaccinated. Right? So I'm not saying, don't get vaccinated. I think you should. I think you should consult your doctor, look at the research yourself. I would personally, I'd trust the experts and go out and get the vaccine, but I don't think it makes sense to mandate a kind of a vaccination on anybody at this stage.
Sure.
A small parenthesis. What about the censorship, the massive censorship that is happening with a lot of doctors and scientists who are trying to bring up their research or their studies, and they're just being constantly silenced because we say that, I'm going to follow the science. That's what we're being told a lot, but we are seeing a massive censorship of doctors, real doctors, not people and it doesn't matter because it's still, it's a freedom of speech violation. And then some people will say, well, social media, they can do whatever. It's like, well, actually not in the Article 19 of the civil rights, our universal human rights, that says that we are allowed to have freedom of speech on any sort of media, no matter the whatever ways we have to show now or to share our information, which is as we evolve through social media or anything, is still our way to have our freedom of speech, and it's being censored. Documents are being censored. A lot of, I have scientists that they have struggled to get their research out, to get their studies out, their tests that they have done to the vials. And how are people going to see this? I feel like that is maybe something that I want to see what you guys feel about that.
And I don't know about kind of separate for myself from that a little bit. I don't know about any censorship or scientists being rush off or whatever. My position is just that, given that we're so early in the research, given that there are a lot of things that are untested and unanswered, I don't think it makes sense to mandate these things. And I think that if I were the average member of the public who doesn't really have time to be a nerd and look into this shit, I could understand the perception that the officials are giving contradictory information because they have, that the media is giving contradictory information because they have. So the narrative that we should just trust the experts, trust the media, and take the vaccine, take all the boosters right now, I think is how people kind of end up on fucking conspiracy websites talking about there being nanogerms in the vaccine or whatever, right? I think we need to be honest about where we are in development.
I think what you're saying there makes sense, that there can be a lot of contradictory information in the media. I'm just going to push back. An informed person is not making a decision to not get the vaccine. That's not true. I don't know what informed means there. It sounds like you're saying informed means they've just seen a lot of stuff, but seeing a lot of stuff doesn't make you an informed person. In terms of false positives on some sorts of tests, generally when these things are reported, it's one or two things and they're incredibly minuscule. There's been a ton of research related to different types of side effects, and if they are big deals, they're being talked about, pretty widely. The J&J vaccine and the AstraZeneca vaccine, you can all you want, Geisha, but the UK and other countries have restricted some of these vaccines to certain groups of people because they are talking about some of the side effects. So if there are big side effects, it seems like people are looking out for these, and if they are, then they make different recommendations based on, the groups of people that might be more adversely affected by these side effects than would be benefited by having the vaccine. And again, I just saying we're early in the research. We've given billions of doses out. So this isn't going to change over the next 10 years. 10 years from now, people with the vaccine in their body was laying dormant and then it attacked their heart and, blew it up or something. So in terms of the average person not having the time to do the research, or the average person getting a lot of conflicting information, I totally agree with that. I think there's a really good conversation here to have about science reporting reporting, but I think it's absolutely incorrect to say that an informed person is saying they don't want to get the vaccine or they don't want to get any boosters, because an informed person is not making that decision. That's an uninformed person or somebody that's been watching too much like crazy media. In terms of like mass censorship happening with doctors and scientists, there is no mass censorship. There are a lot of social media platforms that are banning people because they have policies related to spreading misinformation about the coronavirus, but there are a multitude of countries, private companies, and universities all over the world that are doing research on this stuff. And when the only doctor you can find to support your stuff is some guy that has a Facebook page, probably is more likely that he's engaging in misinformation, even if he has a PhD, than every single country, company, and university around the planet is conspiring to silence just these people.
Gootecks, really quick, do you feel that the scientists, well, first off, are you vaccinated?
No, I'm not vaccinated.
Okay. Do you feel like the science is pretty settled on it? Do you feel like there's enough information out there that people should be able to determine at this point that the vaccine is safe?
No, I don't think it's settled at all. I mean, there's lots of different, there's tons of reports on the VAERS database about the different adverse events that get reported all the time. Obviously, as we can all agree, like it's still approved for emergency use authorization. Like there are no long-term studies because it really hasn't been that long. So I don't think it's settled, and it is true. Like time will tell as to what the end result is, years from now. But I mean, when you look at the development of myocarditis, especially in young men, I mean, it is quite disturbing. So to me, no, it's totally not settled. What's every experiment needs a control group, right? So, me and Geisha just volunteered to be in the control group.
So what's disturbing about myocarditis showing up in young men?
Well, I mean, if they didn't have that before and then they took the vaccine and then they have myocarditis, I mean, I would be, that sounds scary to me. The myocarditis doesn't last very long, and it's an immune response. We should expect that, especially on the second shot, that somebody's exhibiting these sort of symptoms, right? I don't think that it's quite that simple. And I mean, there's not, I don't, oh, okay. All right. Well, since you say so, now I'm convinced. Okay.
Can I ask you a question? Why are you so much more concerned about myocarditis from the vaccine than myocarditis from the coronavirus?
Well, because first off, because the chances of surviving the coronavirus
Stop. We're not, what are the chances of surviving the vaccine? We're not talking about surviving. We're talking about myocarditis. So I'm asking you, why are you more concerned about myocarditis from the vaccine than myocarditis from the coronavirus?
Since when myocarditis is...
There's no answer to this. I'm just saying this is like I don't know why you guys bring this up. You're like, myocarditis. Myocarditis is like 7 times worse if you have the coronavirus. Why are you more concerned about myocarditis from the vaccine than from the actual coronavirus?
Is Destiny, so the question I have to ask, just to be sure.
Why can't you answer the question? I want to hear. I'm curious.
Blood clots. It's official. Like that information is out that the vaccine is causing blood clots.
No, it's not. There were only 2 that were doing it. It was the AstraZeneca one and it was the J&J one, and there was restrictions on that for a while when they investigated it. But for the mRNA vaccines, which are probably the ones you're the most concerned about, that is not the case. There is an increased risk of blood clots for taking birth control. Okay, just because there's like a minute increase doesn't mean that we would halt the entire vaccination program. And again, my understanding is that only happened with the ones that were tuned to the adenovirus or whatever, the J&J and the AstraZeneca one, not the mRNA ones. So I want to know, why is myocarditis more of a concern for the vaccines than it is for the actual infection itself?
Well, just to make sure, trust me, he'll be able to ask the question, I promise you. I just want to ask really quickly, is there any correlation between myocarditis and the coronavirus? I've never even heard of it whatsoever.
Absolutely, of course. One of the main concerns about it.
Yeah, your risk of getting it is higher if you get the coronavirus. That's for sure. If you get the actual virus or not, but there is an increased risk if you get the vaccine. And I think the concern that some people have is that if you're getting a booster after booster every 3 or 4 months, because the efficacy does drop off after about 3 or 4 months for the Delta variant for the Pfizer vaccine, for example. So if you're getting booster after booster every 3 or 4 months to stay to keep the efficacy up, is there also an increase in the risk of myocarditis every time you get the booster shot? I think that's what people are concerned about. I don't know how fair concern that is, given that the risk of getting myocarditis as a result of COVID is still higher than that.
So I want to know, why are we concerned about myocarditis from the vaccines but not from the coronavirus?
200 athletes, like they passed out. Some of them died because
No, that's not true.
that they had the vaccine.
No, that's not true. Why are we more concerned about the myocarditis from the vaccines instead of from the disease?
Because they started to say, which is usually the media started to say, that coronavirus now gives heart attacks and stuff. Like,
We're not talking about heart attacks. We're talking about myocarditis. We're talking about inflammation of the blood vessels in the heart.
they are giving the vaccine, and this already has been out about how it's causing myocarditis. And the chances of having a side effect from the vaccine is higher than dying from a flu.
Okay, just a minute, Geisha. So, Gootecks, can you answer that? What would your response be to that? Why would you be more concerned with myocarditis from the vaccine as opposed to the coronavirus? It seemed like you weren't even aware that there was myocarditis.
I've never even heard that.
Do you think it's kind of strange that you're so obsessed with looking at the side effects from the vaccine, but you don't even know what the vaccine is protecting against? Do you think that might show a little bit of a bias in terms of your research habits?
About something that you are 99% more likely to survive.
How likely are you to survive the vaccine if billions of doses have been given out? Geisha, how likely are you to survive the vaccine?
I have family who now have heart problems after they took the vaccine.
Sure, and a lot of people know people that are dead after getting the coronavirus.
People are dead. Like, what?
What?
We know a lot of people know people that are dead now because they've gotten the coronavirus. But if they have heart issues, it sounds like they survived. So are we using survival, or are we talking about myocarditis?
Exactly, it was death through the coronavirus, because we know that a lot of hospitals were getting funded. They were getting paid for claiming that they had COVID death.
Why is it that you guys? So I just like to look at the bias. So why are you so worried about everything being labeled? Why are you?
Hold on, Destiny. Let her finish, please.
There's actually, you can look it up. They made legal that the government, for whatever reason, can fake data.
No, they didn't.
So-
That's not true.
What?
Well, 1 second.
Okay, they didn't make. You can look at the
financial
CDC
incentive.
guidelines.
What Geisha is saying is that there's a financial incentive for hospitals to report COVID cases as well as to put people on the ventilators. Is that right?
There's a financial incentive to code for anything that requires increased risk of care. Like, that's how care works.
There's also
Hold on.
E19 statistic data. I repeat, 2019 federal law will authorize fake COVID-19 statistic data.
It sounds to me like you're reading a Facebook or Instagram post. I don't know what you're.
No. You can find it. This was in the Defender or whatever, and this is just them reporting what they said, that this is a method that allows the government agency to share fake data and statistic, including national security and law enforcement for law enforcement purposes.
Can you tell me where you're reading this from?
Wait, I'll show you.
Like, you understand how insane it is? You're saying that the government said we can fake data. Like, what?
Oh, it's here. That's what they says here. The Defender. That's what they posted this stuff.
Okay, so let's shift gears a little bit. If we can.
I have a question actually. What I really want to get at here is are y'all like, so y'all sound vaccine skeptic and whatnot, but is it because of like, are y'all against like a mandate happening here, or like where are we at with this? I feel like there's like, what I really want to get to at the heart of it here with Geisha and Gootecks is more like, what's your criteria to approve the vaccine? Because Gootecks kind of name dropped here that, we don't want to be guinea pigs for 3 years onward until we figure out the long-term studies and whatnot. So is it like, are we putting a value here that we really shouldn't be, in your opinion, doing any kind of vaccine deploying until we have long-term 3-year studies done and just let all this death happen? Or like, what's your metric for success? Help me understand.
It's a human right. It's a human right.
Wait, Geisha, hold on. Geisha, let Gootecks respond. He asked Gootecks, please.
Okay, so what you're asking is, what is my criteria for taking the vaccine?
Yeah, approving it, and you're like, what's your idealized success story going forward? Because you said yourself here that you like, you don't want to be a guinea pig for 3 years straight, or 3 years early. You want some long-term studies done, which would require years to get there, implying that there's like a timetable where you want to like, until we have 5 years of data on vaccine deploying, you wouldn't do it yourself. I'm trying to understand.
It's less about that. I don't think of it that way. To me, it's quite simple, and I think you guys are kind of missing my main point, which is that I personally, I'm not at risk. A 99.97% survival rate for somebody like myself is not cause for concern. So because that's the way that I see it, I don't see I don't see the upside of taking a vaccine for something that I think I have a really good chance of surviving anyways. And I probably already even had it, maybe even twice. I don't even know. I've never gotten tested. So it's not something. The what?
I'm sorry, just a quick one. What about the infectiousness rate? Like how prevalent it is for you to spread to other people?
I think that everybody needs to take responsibility for themselves. And because the success rate, the survival rate is so high, most people are going to make it. But if you're scared, you should take extra precautions, which is why, if people want to take the vaccines, they are free to do so. But that doesn't have anything to do. I mean, I don't see it that way. Like, that's not my responsibility to look out for every single person. That's everybody's own personal responsibility. Because I think that's the real heart of the issue, is whether or not you think that it's that everybody else's like security and safety is their own responsibility or the responsibility of everybody. So for me, I just weigh the risk reward on like taking an experimental injection versus just taking my chances with living my life.
I think if you could make again, if you do your research and of course you're going to come to your conclusion, it's going to sound logical to you. But if you did weighted analysis and you go, okay, I'm putting myself at direct harm. Should I put myself in direct harm to protect other people? I don't think anybody here would ask you to do that. But it seems like it's for the most part pretty safe. Like Destiny was saying, but there's been doses, and maybe there's like a handful of like very limited cases of myocarditis, and maybe in the future we'll find more things to figure it out. Again, I know you're gonna have your own sources there, but it seems like for the most part it's overwhelmingly safe, and you're helping people.
I think there's tons of. I mean, have you guys actually looked at the VAERS database?
Okay, why do we keep using the VAERS database talking point?
Because it's an official government source.
What do you think? Can you tell me what a VAERS report is?
And where are we supposed to use
vaccine adverse event report?
By who? What does it mean?
What do you mean? What does it mean?
What is it? Like, tell me, what is a VAERS report?
I will.
Okay, it's okay. So a VAERS. So it's interesting to me because people will say it's bullshit that every single death was coded as a coronavirus death, which is not true. But you guys use that talking point over and over again. But then you'll go and you'll appeal to the authority of the VAERS database. VAERS database is just a database that you use to explore hypotheses. Okay, a VAERS report is literally just like, I can make this report to the CDC if I feel like I have an adverse event and I report it to my doctor. Like, oh, I got a cough after I got the vaccine, or oh, like I have a big hemorrhoid now after I got my vaccine, and then you report it. That's it. The VAERS database is not like we have confirmed that every single adverse event here was a result of a vaccination. No sane person is going to report results off the VAERS database. Rather, you use tools to comb through data from the VAERS database. You build a hypothesis, and then you start testing groups of that versus other people in the population to see if something actually happened. You don't just say, here's a VAERS database report. It means nothing. Anybody, you can make one right now. Well, you can't because you weren't vaccinated, but anybody that's gotten vaccinated can call their doctor and make what would be reported to the VAERS database as an adverse event, whether or not it happened, whether or not it was related to the coronavirus vaccine, whether or not it was just you feeling bad that day. It means nothing.
Okay, so Destiny, it seems like the purpose of because I'm not particularly familiar with the VAERS report, but it sounds like the purpose of the VAERS report is specifically so that people can report whatever they're experiencing. And then, yeah, like you said, we would use tools to then glean like information from that to try to determine if there's some sort of correlation between what people's experiences are and what is actually happening.
Exactly.
Right?
Yep.
And so then it seems like if that's the purpose, that I guess trying to reflect upon VAERS data in order to try to see some sort of correlations seems like that's literally the entire intention. Now, obviously, we're not experts ourselves, right? And so we're not going to have like the perfect insight into like making sure we're controlling and all those things. That's the purpose of people actually running studies. But it does seem like we should be able to glean some information from VAERS
absolutely
data,
not.
right?
Well, I mean, like if we see a bunch of adverse events that are reported, then yeah, it's cause for further investigation. But when you've got people out here that are spreading a record amount of misinformation about this vaccine, and then you've got more people that have ever gotten this vaccine than ever ever in human history, combined with the fact that literally anybody, you can go online right now. You go to the VAERS.hhs.gov and you could fill out your own VAERS reporting form right now that will be logged amongst all the others. And I think it might even be publicly accessible where people that have access to the database can see it. The idea that like these are some like, absolutely confirmed adverse medical event related to the vaccine is just not true. You're treating this with so much authority when it's not. Anybody can fill one of these out. Now, if the purpose of these forums is, let's say a whole bunch of people start saying like, hey, my left arm hurts, or hey, I'm having trouble seeing, or whatever, then the CDC or another company might look in and be like, okay, well, hold on, we need to research this. This is like really fucked up. Like, we need to see what's going on. And then people will use this for further research. And we have used this for further research. And that's where all of our data comes from for adverse events relating to vaccines. People act like the VAERS database is this unknown, hidden database of all these adverse reactions that nobody is studying. Everybody is looking to this database to make sure that the vaccines are safe.
So do you think that there are like a large amount of people who are like fabricating information on the VAERS reports?
It could be. But I mean, I'm saying that people that look into it haven't found like, oh, here are some things that are cause for concern.
I think the reason for pause is trying to front run a conclusion from the VAERS report. I get like again, like you said, we're not experts. So just seeing like a stream of data and then just coming to a conclusion that it seems like there's like something negative happening, it could just be noise. And until we kind of get more educated people's opinion on it, we shouldn't really try to defer to that as a reason to not do something.
There's tens of thousands of deaths reported in there.
And there's hundreds of millions of people that have been vaccinated. You'll come out here and you'll say, if somebody got shot in the head, they coded as a coronavirus death. Somebody could literally fill out a VAERS thing because their aunt died because she was 85 years old, got the coronavirus vaccine 2 weeks ago, and then fell down the stairs and killed herself. Like, and then people can report that as an event.
Are you aware it's a felony to forge a VAERS database report?
It's also a felony to lie in an affidavit to be used in court. But look how many affidavits Giuliani had to prove election fraud. That doesn't mean anything. Not all of these are prosecuted. You could fill out one of these. Yeah, hey, surfshark.deal/destiny, get a VPN account. You can go ahead and do it yourself. You can do all the fraud you want. Like, what do you mean? Just because it's fraudulent to do it doesn't mean people won't do it, especially when there's so much incentive right now to lie and to spread misinformation about the vaccine, of course. And not only that, people could be genuinely reporting side effects that they're having. Doesn't mean they're lying, but maybe I go get the vaccine and then I come home and maybe I just feel like, oh, I've got a cough or something, or maybe there's an underlying condition and I report an adverse event that might be a true report. I'm not lying, but it's not really related to the vaccine.
So it sounds like I guess I kind of get like, just it seems like if it is a felony in order to like fabricate that sort of information, then it seems like we should be able to at least put some weight on the reports themselves and assume that it's not like that there's some mass fabrication of these reports, right? Like that these things are mostly accurate, or do you disagree with that? Do you think
it doesn't have to be fabricated to be incorrect? For instance, look how many dipshits play League of Legends as jungle and blame their AD carry for losing the game. There's probably a lot of people that report that. It doesn't mean that's actually why they lost. They lost because they're jungle players and they're degenerate fucks, okay? The average age of the person reporting a death in VAERS is like 72 years old, right? There's probably a lot of legitimate people that died afterwards, and there's probably people that had legitimate symptoms afterwards. It doesn't mean it was related to the vaccine. This is only your step one report. This isn't a survey, or I'm sorry, this isn't like a study. This isn't a systematic review. This isn't a huge published database where we're going through and we're vetting everything. This is literally just, you got a vaccine, you feel something a week or whatever later, and then you just report to your doctor, hey, here's a side effect. There's tons of people reporting tons of stuff. There's gonna be a lot of noise in here.
Yeah. Especially they reported a lot of myocarditis in there.
Which is less than myocarditis reported for the SARS-CoV-2 virus. If you care about myocarditis, you should want to get vaccinated, because your chance of having myocarditis as a result of the vaccination is like 5 times less than if you actually get infected with the disease.
So there was a point I wanted to pick on earlier before I moved on, just because Gootecks replied to my asking of that long-term research and whatnot. And it seemed like you didn't really have much concern here over really you're really fixated on individual agency and not any kind of I haven't heard you really address here the whole asymptomatic spreading that unvaccinated people are able to kind of reinforce further to honestly prolong the pandemic. So I'm just curious here, did you have anything you wanted to elaborate on there? Because I didn't really hear you really address that, other than a lot of self-righteous rights to just not get vaccinated. But in that case, are we just not going to address here the asymptomatic spread of COVID?
I mean, as far as I know, asymptomatic spread was one of the first things that got debunked, but it was so long ago, honestly. I can dig it up if you want, but this idea that you have to get tested when you don't have symptoms, or that there's all of this spread without symptoms, like I think is largely not. I think that's largely not true. So that's and really, like, even it still kind of comes down to the suppression of early treatment protocols like hydroxychloroquine and ivermectin and now monoclonal antibodies. So all of those things combined, I mean, along with personal responsibility, to me, would have solved this whole thing a long time ago. But that's not something that we ever talk about.
Okay, one of these things is not like the other one. You can't say there's suppression of monoclonal antibodies when that's literally an FDA, EUA, like emergency use authorization approved treatment. There is no suppression of monoclonal antibodies. No. But number two, ivermectin and hydroxychloroquine. Neither of these are. That's not what I mean. I mean that I'm not saying that treatment itself is suppressed. I mean that it's not something that's like talked up. Because it's really fucking expensive. There's not much available.
No, it's free. No, it's free.
I'm telling you, you're dead wrong. You cannot easily get the monoclonal antibodies depending on where you are. It is absolutely not true. My mom literally just had the coronavirus a week ago, and they looked everywhere to shop around for this, and they said the wait list was huge for this shit. So yeah, number one,
that changed recently because they pulled like a bunch of the doses. But for a long time, that was not the case.
Okay, do you think it might be because more people are using it? The idea that they're pulling it, why would the FDA give EUA to it and then try to hamper it? Why wouldn't they just not approve it?
No. It's something that most people were not aware of up until relatively recently.
Isn't that because it just got approved EUA relatively recently? How long ago did it get authorization?
I don't know. It's been months and months and months.
Also, secondly, so hydroxychloroquine and ivermectin have been extensively studied. Hydroxychloroquine has absolutely shown no good use for standard of care when we're talking about treating.
There's tons of studies. They published it in January in the AMA journal that it is effective. No. And it's not just that it's effective. It needs to be used with azithromycin and zinc.
Yeah, I know. We've heard the azithromycin, antibiotic, and zinc every single time. They've looked at this versus standard of care in other countries. It doesn't work. Same thing with ivermectin as well. There's a ton of research on ivermectin. There are no countries that use either of these two drugs for treatment, and it doesn't work.
No. Oh my God. India, Japan
absolutely
Africa.
Does not. No, Africa's not a country. Okay, no. And also, just because some hospitals use it doesn't mean that this is the standard of care in a country. Okay, ivermectin has not shown any efficacy for treating SARS-CoV-2, and neither is hydroxychloroquine.
Hey,
just a second.
Honestly, like this is.
If we could wait 1 second, please. One second. Like let's try to slow it down because it's starting to get really cantankerous. So, regarding ivermectin, was there a pretty heavy like usage of ivermectin when India like encountered its crazy COVID spikes?
Yeah.
And they still got huge spikes. There was no ivermectin.
You can go to ivmmeta.com.
We can't 3 people at a time. Just
sorry. Go ahead.
You go first, Gootecks, and then Geisha.
Yeah, you can go to ivmmeta.com. There's 73 studies listed. You can look through them yourself. I mean, there's tons of different. I mean, in India, they've been using it. In Japan, they started using it several months ago.
So you can go to websites that contain a ton of garbage preprint studies. Half of these end up getting pulled. Some of the largest ones for ivermectin did get pulled because the data just wasn't good, or because the data set didn't exist. Or in one of the the largest ivermectin study, the data set was fabricated. There were copy pasting rows of the data. I think it was some tech guys that ended up sorting through the database to figure this out, where they were just copy pasting rows. And it was very obvious because the patients had the exact same descriptions. So no, also Japan does not use ivermectin. I don't know where this talking point came from. I'm pretty sure they say it explicitly on their public health website. They do not use ivermectin to treat this. Maybe this came from a Joe Rogan show, and that's why everybody's repeating it. Ivermectin has not. The only place where ivermectin has been shown to be helpful in treating the coronavirus are in cases where, surprise, surprise, certain types of parasites are very common. Chances are the ivermectin is just helping either as a prophylactic or as a treatment because it's probably treating a parasite, not because it's helping with a viral infection.
Wait, okay, Geisha, were you aware of ivermectin being used in India at all?
We've been treating in my country for a whole year until they started saying that now we need vaccines, and then they stopped. All of the doctors try to not prescribe it, because it seems like there's a hierarchy in medicine where there's a main guy in the politics, like in the office, and they started saying that they need to start recommending the vaccine instead of ivermectin. We were treating people for a whole year. There was almost no death in my country at all due to COVID. And still till this day, I still ship ivermectin here, and I have hydroxychloroquine. And every time, if I have a little cold or anything, I use hydroxychloroquine, and it's like I never feel like it doesn't last for long. Like even the worst times that I see everybody sick around me, it barely, like I'll feel something in my nose, and then 2 days I'll be like back in track, like feeling great. I have experienced many times that it's something that works, not like because I just say so. I've tried it myself. My family has tried it, and like people around me have tried it as well, because they've seen that it does help you when you're feeling sick, and not just with COVID, but any other like virus of, because kind of they're very similar, SARS-CoV-1 or 2, but it helps you heal faster, a difference to a lot of pharmaceutical products that tell you that they're going to alleviate symptoms. You want the body to heal. You want to not to just make you feel sedated or something, if you want to get rid of an illness or any sort of viruses.
Have you gotten tested ever for having the coronavirus?
Yeah.
Did you have the coronavirus when you were using ivermectin?
I don't test anymore.
So then you have no idea if either of these medications helped you recover from the coronavirus. That entire anecdote was worthless. You might have literally just had a head cold. You might have had.
Wasn't that?
You might have had a cold, and then you took some random pills because somebody on the internet told you to, and you think that it cured you. You have no idea. Number one. Number two, Merck, the company that makes, one of those evil pharmaceutical companies that makes the ivermectin pill, literally published on their website that there was no data showing that their ivermectin pills were effective at treating SARS-CoV-2. It literally is published on their website. Do you want to put?
You can go to jail for discrediting ivermectin in India because people die due to politicians and people talking negatively about something that helps you get rid of a virus.
Geisha, ivermectin and HCQ, hydroxychloroquine, were literally dropped from India's COVID-19 treatment protocol in September. You're lying, okay? Here's the story right here. Boom, go read it. You don't have to make yourself look any dumber, okay? They literally dropped it from their treatment protocol because there's no evidence that it works, okay? Now, why is it that Merck, the private company that makes the pill, why is it that Merck, the company that makes the pill ivermectin, they themselves said it wasn't effective at treating the coronavirus? Why?
Because it's big pharma, for God's sake.
They are big pharma. They're big. That's big pharma.
That helps. They will not want something like that.
But they're big pharma. Why wouldn't they say their pill helps? They can sell their pill. They make more money. They're big pharma.
For example, I can myself create my own brand of hydroxychloroquine if I want to.
We're not talking about. I'm talking about ivermectin.
Okay, so what's it? Are they going to lose more or less? If you're going to make more money selling a vaccine to the whole world?
I don't think Merck has a vaccine, do they? Merck has a pill derived from, I think it comes from ivermectin. Their ivermectin pill. So they released a statement on their own pill saying that there was no therapeutic effect against COVID-19.
So why do you think they will say that?
Hold on,
I don't
really
know.
quickly.
It's their own pill. They stand to profit from it if more people buy it.
So Destiny, from this thing that you just linked, I'm looking in one of the paragraphs, and it says recommending that ivermectin be dropped from the clinical guidance. Experts cited 13 systematic reviews, of which 7 out of 13 showed mortality benefit, 4 out of 13 no mortality benefit, and 2 out of 13 inconclusive or unclear. So it seems like if 7 out of the 13 things that showed there was a mortality benefit, then it seems like ivermectin was somewhat effective, right?
Because it depends on the quality of the study, and it depends on the quality of the studies that they're citing. My guess is that if they're willing to drop it from their recommended for their clinical guidelines, then the 7 out of 13 that showed mortality benefit probably weren't studies that were done well. So they weren't like randomized controlled trials or prospective studies.
So then why would they use those ones to cite it if these are the only studies you have?
Probably because if you're going to make a recommendation, you want to cite the totality of the evidence. Otherwise, people like Geisha would be like, oh, well, look, they didn't even look at all the studies. That'd be my guess.
Okay. I hear you. All right, Jeff, let me ask you a question really quickly. I believe at one point...
Oh, wait, hold on. Wait, I just want to respond to you, because if you read one paragraph down from what you just said, additionally, there was a high risk of bias in many of the studies, particularly with the ones showing mortality benefit, as the level of certainty is low in them. That's what it says in the next paragraph.
Okay. All right. I respect that. Jeff, you at one point you had said, I'm sorry, you're vaccinated, as I'm aware. Did you get it immediately, or were you hesitant, reluctant? Like, how was that process for you?
It's probably like socially taboo. I was like, let the old people get it first because they need it if it worked, and if they figure something out, then they live. They live long enough. That's more tongue in cheek, but I was a little bit, it's new. And I wasn't on that list of people who were approved to get it early. Once it became general purpose, it was something that was always in the back of my mind. I just never really left the house. I was a homebody, so I didn't really get it for a while. I kind of got it in, I want to say it was April. I think I got it in April, and then I got the second dose in July. But yeah, I never had a problem with it. I never really had a problem with it. I was in enough comorbidities, being black, overweight, having high blood pressure, that if I randomly get it, there's a high chance that it can kick your ass. And it doesn't make sense to roll those kind of odds. So yeah, I was very easy to get it. And then my job also gave me $1,000 for getting the vaccine. So I got a vaccine for the vaccine.
You're saying I hate you so much.
Yeah.
I'm so upset.
Yeah.
Are you raising your hand, or that's just?
Yeah, Dooby's raising his hand.
Oh, is that? Oh, Dooby, what's up?
So yeah, I'm just kind of curious because I, like I said, I'm somebody who did take the vaccine, and I think it made a lot of sense for me to do it. But given that the data that's currently available is limited because studies aren't complete, some of the data is contradictory, and our understanding of the virus and its variants is still evolving. I mean, as far as I'm aware, there are currently 12 known COVID variants. With Delta and Omicron being variants that are currently classified as variants of concern, there's evidence of an IHU variant emerging that might become a variant of concern. And we know that the AstraZeneca vaccine, for example, even if you get 2 doses of it, it's still only 67% effective against the Delta variant. And that efficacy begins to drop off even more after 6 months. Right? So there are a lot of questions about how effective the vaccines currently available are and how effective the boosters are against the variants that are out there. Right? So given that that's the case, right, is there anybody here who would be for mandating vaccines for all citizens who don't have an underlying health condition that would make them exempt? So I think that's what my problem is, right? I think that it doesn't make sense to mandate this thing for people, given that there's so many answered questions right now.
You beat me to it. That was going to be the next question, actually. Go ahead.
When you're saying mandating, you're talking about the government busting in people's doors and jabbing them?
Well, so for example, in some places in Australia, there are, I don't know what to call them, vaccine squads that are going out to the Aboriginal communities, to their houses, and not busting down the door and holding them down to give them a vaccine, but showing up and saying, "Hey, here's a vaccine. It's required that you take it." That sort of thing, right? So yeah, that
they're telling them that they must take it, or they have the option to take it, and it's really easy. We're making it as easy as possible for you to just take it.
My understanding is that it's been mandated, but if it hasn't, if I'm incorrect about that going on in Australia, and when they're showing up at the store, they're just saying, "Hey, here's a vaccine if you want to take it." But what I'm asking is if they did mandate this, right, for every adult that didn't have some other underlying health condition, would any of you be for that?
For me, it's absolutely not, especially with the Omicron variant right now. It's so not deadly and highly infectious that it seems it's gonna everybody's gonna get it at this point. That if you're vaccinated and you're caught up on your boosters, and the monoclonal antibodies don't actually show that much effectiveness against the Omicron variant, but the death rate isn't that high anyways. At this point, you're responsible for yourself. We have the tools now with the vaccines to combat against this, and it's not very deadly anyways.
I don't think we can mandate it. It's just a loser politically. I think we just have to let it go. Let people die, let it spread, let it mutate, whatever the fuck. I think that battle has been lost at this point to all the misinformation and everything. I don't think it's worth it to go down that road.
Yep. But we can always look back at the actual deaths that were caused by the misinformation that was spread, and the exposure of our country's weaknesses towards misinformation and towards bioweapons in the future, especially if you go down the whole rabbit hole of this being engineered in a lab, shows that the U.S. is very susceptible to getting destroyed by an actual virus. Yeah.
If I may here, yeah. So if we're to break down the logistics and execution of the mandate, in reality, we're asking about a mandate in order to be able to mitigate the further spread of COVID, so we can kind of end the pandemic and get over it. So yeah, the vaccine mandate is not really going to help the vaccine skeptic or the vaccine hesitant to really engage. They're going to just find a new excuse to think it's Big Brother taking over or whatever, possibly, or more. Rather, we got to do a more of a pro benefit. You got to perk up the benefits or perk up the worker safety protocol so that people can safely quarantine, isolate. Whether that means I would, for example, I would probably be more into some kind of segregation, if you will, where you just allow, if you want to be no vaxxed, and yeah, here are like no vax zones, and then there's like vaccination zones you can go to comparatively. Again, very different than having like a vaccine passport or a vaccine mandate, but rather just like think of it like smoking and non-smoking. I would entertain that way before I would entertain a vaccine mandate. But before both of those, I would heavily explore like things we can do to really get that vaccine adoption going in a positive way where people want to, because they see that as a solution to stopping the spread of COVID so we can get over the pandemic, so we can return to normal, rather than pretend where we are right now is normal.
Like a payment for
Jeff,
vaccine.
1 second.
So to be clear,
Jeff, you were nodding when he said like segregating people in that way. Do you think that would be a good idea?
Yeah, put them all in Kansas, like someplace we just really don't need, and just wall them right off.
Right. I'm so angry for asking the question.
I can elaborate there if you want me to. I know I use the word segregation and it has like a negative connotation, but I can elaborate if you want to hear more what I'm getting at there.
Sure, please.
That'd be great.
Quick. And then Dooby, you can respond.
Yeah, so more what I'm getting at there is like, so ultimately, hypothetically, if there's like a lot of people who are like COVID conscious who want, I want to go to movie theaters, concerts, large gatherings, weddings, etc. But I'm concerned that there are people, because we have like a really shitty vaccination verification right now, where like it's a fucking piece of paper with no federal log of who got vaxxed with what dose at what point, etc. So ultimately, it's just kind of like a shit show to want to go to a theater, to want to go to restaurants that don't cater to a vaccine passport of some type here. So therefore, I think there's commercial viability. I'm trying to make the economists here happy now. There's commercial viability to catering to those who are like who are COVID aware like myself and want to just be able to do what we did before 2020 safely. So I'm just like, yeah, let the businesses decide. Let them go ahead, and of course they're going to cater to just like having the max amount of people as possible. But just if there's two restaurants, one is openly welcoming unvaccinated, and the other is opening vaccinations. I would like to see that at least explored and see where that goes, so that those who are getting vaccinated at least have the option to be able to like, I don't know, like move on to some kind of like, hey, here's the prosperity that all the unvaccinated want to be in, minus the risk, and maybe that would possibly lure the unvaccinated to maybe see the vaccination in a different light, rather than conspiratorial and a negative. Maybe.
Dooby, you gotta knock this one out.
Yeah. Well, yeah, I'm just kind of curious as to like how far you could take that. So if you're okay with like vaccine segregation for COVID, like anti-vaxxers, right? Would you extend that same level of like segregation to people who were hesitant about other vaccines, like the chickenpox vaccine or diphtheria or the flu vaccine?
We already have that now, do we not?
Hepatitis. Well, we have that for like kids who want to go to like a public school. Mm-hmm. Right, but I think you're talking about like public spaces, not just like public buildings, right? So like hepatitis B. So would you also have segregated spaces for those people because they're refusing to get the other vaccines that we're currently mandating?
Are those asymptomatically spreading and or causing a mass amount of death that we've never seen before? That's the issue, right?
I guess not, but you could argue that this because we I guess not, but you could argue that's because we currently require them for kids who go to public school, right? So most people have those vaccines. So if there were like someone out there who didn't want to get the hepatitis B vaccine or the chickenpox vaccine or whatever, would you be in favor of segregation for those people along with the COVID anti-vaccine?
I'm trying to see like the point of your hypothetical here. If there's already like the catch-all protocol, if they go through public school, they're gonna get those vaccines anyway. Then why are we in a principled sense, if it doesn't cause asymptomatic problematic spread where, your body, your choice, your decision is now affecting other safety by your existence, that changes the whole paradigm here. That's the issue.
Is that true though?
What about the annual flu vaccine? Like
about it,
that affects other people if you don't get it, right? You could get the flu, not have the symptoms, and still pass it to another person.
We don't have hospitalizations and death at the rate we have right now with COVID flu. That's the difference there. The severity of what COVID can do on the infection is what changes the situation. Yeah, flu doesn't bother me. I mean, it would be nice if people got the flu shot yearly. Certainly, I'd like you to do that for your own safety, honestly. But yeah, no, that one, it doesn't bother me. No, there's like, you're trying to find a slippery slope to pin me in down here with like.
I'm not. I'm not trying to like slippery slope into it. I'm just trying to understand like what the threshold is, because over 30,000 people die of the flu every year.
Severity of the infection. 830,000 Americans dead. ICU wards were overwhelmed. Medical professionals hospitals were at full capacity back in August of 2021, and then some. That is a severity that I find is problematic in disrupting society and endangering a lot of people.
Okay. So if the flu were right now, it's about 30,000 a year. If it were at like 100,000, you say that we should have like mandated flu vaccines and I'm sorry, not mandated vaccines. I mean, vaccine segregation for people that aren't getting the flu vaccine every year.
I mean, we could find a number if you want me to, but the point, rather than trying to find a specificity over like where the flu's lethalness would be of concern, the point is that it's not. So that why are we entertaining that in the first place here? That's the difference. In reality right now, the COVID lethality is much different than the flu one. And that difference is what is the danger here.
Okay, so let me ask a question really quick. Gootecks, would you say, just because algorithms a lot of time forces into different kind of bubbles, and so we interact with totally different people. Would you say that the mandates have been something that have kind of discouraged some people who might have been on the fence from actually getting the vaccines? Do you feel like that the more the government gets forceful regarding vaccines, do you feel that it makes some people even more hesitant?
Yeah, I think that definitely plays a role in it. When you force people to do something, or you coerce them, or you make their life purposefully difficult in order to persuade them to perform some sort of behavior that you want, like, of course it's going to make the problem worse for some people. For other people, they're just going to go along with the program. The challenge, or I guess the battle, is for the people that are in between. Because basically everybody here is already sort of set one way or the other on what their decision making is and what their worldview is. So the mandates really are about the people in the middle that can be swayed one way or the other.
I don't think the mandates are about swaying people. I think the mandates are effective, but that's only because I think the vast majority of people that haven't been vaccinated are just kind of like lazy, or they just don't really want to go do it. I think there's a lot of people out there, or it seemed to be the case that there were a lot of people out there that like they knew the vaccines are probably good, but they're not like in a group that's super affected and they don't really care that much. But if work was like, you have to get vaccinated to come in, they're like, oh, fuck it, I'll go do it. I don't think that of the vast majority of people that are not vaccinated, I don't think that a lot of them have super strong opinions about like the vaccine. They're just kind of like, whatever. And then if they're forced to do it, they'll do it.
At this point, I think maybe early on that was the case, but I mean, it's been, it's been like a full year now. Yeah.
I mean, at this point, it's probably getting closer and closer to that being the case, but.
Good observation. That's what I was going to point out.
I had a question. It was like kind of during the last topic. And so the two that are kind of pro, they don't feel like the vaccination is important. They feel like there are treatments for the vaccination, and they also feel like the mortality is not that high. Do you have any consideration for long COVID? Like, does long COVID scare you at all? Because there seems to be that there are people who are having very long-term, like, let's say you get very, very gravely ill. It seems like it's having long-term effects on people's health as well. Does that concern you?
I mean, it doesn't concern me because I think that the way that COVID affects you physically is largely related to what your decision making was leading up to that point. For example, if you're somebody who works out, eats healthy, takes care of yourself, at least as far as I can tell, you're not going to be super heavily affected, especially at this point. I mean, with Omicron not being super deadly or anything. So, I personally haven't done a lot of research on long COVID because it's not something, because I think it's just proportionate to how well you take care of yourself in the first place.
Grimace,
so one point I actually wanted to add on here about the hesitancy thing is that as Destiny was bringing up earlier about people who are just like lazy and not getting it. Another thing that would really help with the adoption here on that hesitancy for those who are just too lazy to do it would also be just strengthening the worker protections. I imagine a lot of people probably not really eager to get pinned down with like the 2 days of fatigue or soreness that they're going to feel when getting the vaccine, if that does happen to them to a severe enough degree to affect their capability to work. So the fact that we don't have like really any federal incentives to go get vaccinated safely, as in like you are guaranteed 3 days off to recover, I think would go a long way. Or just like even just paid time off, that way you're not like losing money, because again we have the whole issue right now with wealth inequality where like majority of working class Americans are, $400 away from sabotage, or they're living check to check in general, and like missing any amount of work is like detrimental to meeting the unaffordable rent in this country. So I could see where if you're on a gig economy like Uber or whatever, and you get put under for 3 days because of the vaccine, that is a very understandable shitty situation to be in, and it would probably cause me to prolong and delay getting vaccinated. So I just wanted to call to action here that worker protections is definitely something the USA is doing really fucking bad at, in terms of like that particular reason why there's a hesitancy to get vaccinated for those who would do it otherwise.
I just want to say, looking up real quick, I don't think long COVID is correlated at all with your level of health or fitness. You can Google like athletes long COVID, and it seems like it's pretty random at who gets affected or who has long-term effects by this. It's not really correlated with your level of fitness or your personal health or anything.
We would need a study to find that though, right? Like we can't look for like individual anecdotes of it happening to individuals. We'd probably have to see, right? Because I don't know for sure that they're correlated at all. I have no idea. I'm not really familiar with that. But like in order for us to be able to make a statement that it's not correlated, we'd have to probably need.
There would need. I don't know if there's like good information about long COVID out right now in terms of studies. I just know that the idea that like if you're healthy or if you're athletic, you don't have to worry about it. That's not true.
What do you think, Gootecks? Do you disagree with that?
I mean, to me, if you're healthy and you take care of yourself and you work out, like the amount that you're affected by any disease is going to be much less than somebody who doesn't take care of themselves. I mean, that's just basic. I mean, it's just basic biology to me. Yeah. So for me, yeah, like it's not a concern.
Okay. I think we probably can switch to the second topic at this point. Does anyone have any closing ideas or closing thoughts on this? Grimace, I know you at one point you said you are vaccinated, but you were there was something about mandates. How did you feel about it, really quickly?
Although for the Omicron, I don't think any kind of mandate's necessary at this point, and we can see that it's endemic. But bring me back like 6 months ago, it'd be like, yeah, I have no problem with the government incentivizing people to get vaccines, like paying them, for instance, or coming to their door and making it really easily available to them, and perhaps giving them a $50 bill to take it because it's really important. We're going to have vaccines. Vaccines work in a way that requires everybody's buy-in, right? So I don't like kill my grandma accidentally or kill somebody else's grandma accidentally. So I would be fine with incentivizing it. I'm fine with the government requiring, just like they do with troops, if they're going to have a closed-in workplaces to require vaccines. That kind of thing sounds fine. And allowing small businesses to make those kind of discriminations against people who are not vaccinated as well. But I'm not like for kicking down doors and giving people the jab. But even all those mandates I just mentioned, as far as it goes now with the latest variant, those don't seem necessary at all either. So at this point, none. Like we need to get off of it and move on. But a couple of months ago, I wish we had something more to get even more people vaccinated to prevent a lot of the deaths that we've been seeing across the country.
That brings me to the next point. We can't get off of this yet. So Omicron, which is oftentimes called the Omarion variant, it seems like it is significantly less lethal, right? Like that seems to be the case, and it seems like it's way more infectious. So it's starting to like very much more resemble the actual common flu, right? At this point, do you think that maybe we should probably rethinking COVID strategy at this point? And do you guys think that COVID is with us for life? In other words, 20 years from now, are there going to be random COVID outbreaks as there are random flu outbreaks, and like COVID season, like there is flu season, and this is just going to be something that's here forever, and we're just going to have to learn to just go ahead and function and live like normal and just get back to like pre-COVID times? Do you think that that's in our future?
I think it's always going to be endemic with us. That seems to be the case at this point. Right now, the science is still out on whether or not it is going to be, whether or not it's more severe or less severe or the same severity as Delta or any of the other variants. It's hard to tell right now because so many people that get sick are already vaccinated, so that might be impacting like the type of people or the types of sickness that people are getting. So, but I mean, it seems at this point, it's probably going to be endemic with us forever. We just have to see how severe it's going to be when all the restrictions lessen up and then what it's like year to year.
Yeah, and we can actually look at the San Francisco area right now. It's like 81% of people are vaccinated, and like the Omicron variant's like ravaging that community right now. But nobody's showing symptoms. Nobody's going to the hospital. The cases are ticking up dramatically, but the hospitalization's barely making it tick upwards right now. I think like we're at least leaning towards it right now as far as evidence goes, that it's much less deadly.
Yeah, so that kind of, I was actually going to ask this earlier. So Trihex, so given what Destiny and Grimace just said, so if it does end up being an endemic and it's not as deadly as previous COVID variants, right? Would you still favor this vaccine segregation? Like some kind of like yearly card that you got when you went and got vaccinated that would allow you access to like the movie theaters and restaurants and whatnot?
Probably not. The severity of infection is what really pushes me towards because it ultimately only came down because of the inaction that we're not even doing to be able to mitigate spread. That's the whole thing that I wanted to see done in the first place. Asymptomatic spread, severity of the infection, the number of deaths happening, disruption to society, and to just the amount of preventable death in general here seems that we can get a lot further along if there was more, if there wasn't having to be this integration of the vulnerable x the unvaccinated to a certain degree. If we were to entertain here that asymptomatic spread is real, which apparently may or may not be according to Gootecks. So
it absolutely is, as illustrated by my point earlier with the San Francisco studies. But Dooby, would you be for mandates if we come up with a strain that's kills 1% or even 10% of people? Would you be for the government busting in doors and giving people the jab?
If it were 1 or 10% of people who got it, yeah, probably. I think kind of as Trihex said earlier, there's a line somewhere. Right. I'm not really sure what it is, but the line, the severity of the infection, the death rates, all these things. And I think all of us would agree that, if it were killing 25% of the people that got it, I would say that I would hope that all of you guys would be in favor of mandating this, right? But we're not right there. So, but if you agree that would be,
the panel think vaccines work, so I don't know if they would be for that. We'd be still fighting.
Well, Gootecks.
Wait.
Well, let me just ask. Let me just ask you.
Man, I don't think anyone said vaccines don't work. I don't think either Geisha or Gootecks have said that vaccines won't work. I think what they were saying is that there might be some sort of problems like myocarditis or other complications that are associated with them.
You should ask them, find out, get it on the record.
Yeah, so Gootecks, can I just ask you directly then? So if a new variant came out tomorrow, and let's call it the Destiny variant, right? We found that it was killing 10% of the people who were infected, and it was highly infectious. With everything that you know now, right, would you be in favor of mandating vaccination for everybody?
If there was a new Destiny variant that was killing 10% of people, I don't think we would need mandates for anything. I think people would just sort of change their behavior accordingly.
Maybe. Yeah, maybe. So but if they didn't, right, and you had a problem getting people vaccinated, as well had a problem getting people vaccinated last year, would you be in favor of a mandate if it were at that level of severity?
No, because still, not even then, because I do not believe that the government has any right to tell people what to put in their bodies. I just don't believe that. That's just a worldview. So no, I don't think that would even, and I don't think it would be necessary.
So if you're in the United States, you sacrifice 30 million people for this philosophical position that you have, basically.
Sacrifice 30 million people? No, I don't see it that way.
Well, they're not going to be safe. They're all the more vulnerable because we're not doing the, I guess, the definitive call to action to do what's better for society over individual liberty.
I think if 10% of the people were dying from the Destiny variant, I think people would adjust their behavior accordingly based on their risk tolerance.
Even with all this information we see peddled out there to make people think that if they take the vaccine, that they themselves will die.
That's wild.
I just think people need to take personal responsibility for their lives. That's just a worldview. So no, it doesn't matter. It doesn't matter to me.
Wait. Should we be allowed to drive drunk if we don't hit anybody?
Oh, I got the same example again.
That's not a. I mean, there's laws against.
I'm asking. Should there be laws against driving drunk if you're not hurting anybody? 'Cause technically, driving drunk is your own personal decision. As long as you don't get in an accident, should it be illegal to drive drunk?
That's against traffic law.
I'm not asking about the law. If there was a law for mandates right now, you wouldn't be in favor of it. So I'm asking you, should it be illegal to drive drunk? If you're not hurting anybody, you just drive drunk in your own car, so you don't get in an accident. Why should that be illegal?
Well, I mean, I guess if drunk driving were killing 10% of people, I guess that would be a big risk. But I still don't see it the same way. I mean, I get the point that you're making. What you're saying is like, well, there's certain conditions in which we have to modify our behavior for the safety of others, right?
It's a super straightforward question. You can talk to it as much as you want. I'll ask again. Do you think that drunk driving should be legal? It's your own personal behavior in your own personal car. You're not guaranteed to hurt anybody doing it. You might. There's a chance, but... So should drunk driving be illegal?
Should drunk? I just don't see. I just don't see it the same way.
What part of it don't you see the same way? I can help make the
Personal
comparison.
liberty over... Yeah.
You have the choice for whether or not you want to engage in a behavior that might risk the health of another person. So do you think you should have a right to engage in that behavior, regardless of that?
Forcing somebody to put something in their body is a totally different discussion. Nobody's forcing people to drive drunk. Nobody's like, the government's not holding people down and then feeding them alcohol. So it's not the same thing.
I didn't say it was the same thing, but it's the idea of like, should the government have a right to see what's in your body? Should the government have a right to see like, what did you drink an hour ago? Should the government have the right to pump your stomach to take a test to see what you put in your body just because of how you want to operate your vehicle? Should the government have access to the contents of your stomach?
I mean, I guess if you get arrested, that's what's going to happen.
Yeah, but you're only getting arrested because it's illegal. I'm asking you, should it be illegal?
It's already like that. It's already like that. It doesn't.
I'm not asking if it is like that. I'm asking if it should be like that. Do you understand the difference between the question? I'm not asking you if it. I'm not asking you the law. I know what the law is on drunk driving. You're not allowed to. I know that. I don't need you to reiterate the law to me. I'm asking you, should it be illegal?
Maybe it's not connecting. Maybe it's not connecting.
It's not even the same thing. I mean, if we were having this conversation before drunk driving laws were enacted.
You seriously can't engage with the question. You seriously
hold on.
can't.
Maybe.
Why are you trying to bail him out? It's obvious what the question is.
I'm not.
You absolutely are.
No, I'm not. I'm not going to run defense. Right. So maybe it's because taking the vaccine is a behavior that'd be like mandated, right? Whereas drunk driving is something you do of your own volition. So what if would you be? Are you like against the government mandating, requiring that people wear clothing when they're in public spaces? Right. This is your body. The government's requiring you to put something onto your body to hide yourself when you're outside in public around children, whatever the fuck. Are you opposed to that?
Who are you asking?
That's just personally. I mean, if I don't even think that. Okay, I don't think that we need laws for behaviors that people do on their own. For example, people
like wearing clothing.
Generally, yes. For example, people generally wear clothes when they leave their house, right? So if
someone chose not to, you wouldn't require them to, and they'd be allowed to watch a.
Me personally, I don't care.
We're not asking if you care. That's a weasel saying I don't care. It's do you think it should be legal or not?
Fine norm. It's not even the same.
No, I don't. No, I don't think it should be illegal. Like for example, like I go to Burning Man, right? Tons of people walking around naked. I don't care. Nobody cares.
You'd be fine with a dude with like a massive dick just swinging back and forth in the breeze, just walking
literally
by public schools like
not
children.
I mean, I would look at him funny for sure.
Yeah.
But
so do you think that adults should be allowed to go?
That we need?
Yeah, should adults be allowed to go naked to the beach?
Sure. Yeah. Why not?
All right. So I think at this point, there's not a whole lot of sense to drill this much further. I think.
I think the refusal to engage with the question shows the hypocrisy. You should be consistent on this manner. Drunk driving should be legal. That's your own personal behavior. That's your choice to do it. The government doesn't have a right to see what you drank an hour ago. That's insane. But if we're saying, well, obviously drunk driving should be illegal, why? Because you're putting other people at risk due to a risky behavior engaging in. Well, that a little bit kind of sort of sounds like what a vaccine mandate is concerned with. So I think it's obvious what the parallel is, but they don't want to engage with the question because it kind of looks bad for their point.
We're not putting people at risk.
You are putting somebody at risk. You absolutely are. Of course you are. You're choosing to engage in a risky behavior. Now you can say whether the risk is greater or smaller or whatever, but you are. But
okay, hold on 1 second. Geisha, finish the thought you were saying. You don't believe that you're putting people at risk by being infected with the coronavirus and exposing them to it?
Exactly. No, not at all. Not at all. And like, what are they going to say now? That the two people who got two vaccinated, I'm putting the people of a booster. Are they putting them now also on risk? Because now they're changing their regulations now, where you used to have, 2, now they are demanding 3, and those that were demanding 3, now they're demanding 4, and you're no longer considered vaccinated at all. So you are now a threat to others. So it's all about how much they just keep putting the narrative of like, we are the public threat until we take what we're told to take. So I'm a healthy person right now. Asymptomatic means no symptoms. They use that term to spread more fear propaganda. We were not supposed to walk around, if you're a healthy person, wearing a mask. That's just pure nonsense. And they're just going to keep pushing. Just because more channels and more TV shows are supporting that, that doesn't mean that that is like what we're seeing. It's actually right, or is done. You know, it's something that's proper. I don't think also that it's correct for governments to be doing deals with pharmaceutical businesses, because that leads to corruption. And as somebody who was born and raised in a country that's packed with corruption, I can tell you that that is happening. And we should be aware when there is corruption. We cannot just pretend that none of this stuff ever happens and that everyone is so great and then like they're doing this for our best interest, because that means that we're being naive. Or maybe we have a second interest of, you know, maybe you're also getting paid off, or you're just, you know, participating with someone. That happens a lot, but you have to be aware that you cannot just demand and say that I am a threat, and then another person is a threat, and then 2 groups of people are a threat, and then just keep saying that everyone is a threat until they take what this pharmaceutical businesses want, or the CDC, which is also the same people as the Pfizer. Like, you have same directors in both companies. So like, how exactly, you know, like it kind of, there's a little bit of a sketchiness of that, that I feel like I should be completely fine for me to question that and to say, I am not okay with that, and I want answers. Why there is a relationship between the CDC, the Pfizer, and stuff like that.
I get the need for answers, but it's really, I feel like we kind of expanded too far there. So let's try to make it as simple as possible. If you have the coronavirus, do you feel that you are dangerous to anyone else who's not infected?
If I what? If I had the coronavirus?
Mm-hmm. Do you think while you're infected with the coronavirus that you are dangerous to anyone else who is not infected?
This is a great question, because I feel that if I have symptoms, whether it was coronavirus or a cold or a flu before the coronavirus pandemic happened, it should be my responsibility as a citizen to understand that I am, you know, I'm somebody who can be contagious to someone. That's how it has been. Like, that's how it has been before 2019 and all of this stuff happened. If you're sick and you go hug a person, you know that you're probably going to get that person sick. And it's your responsibility to, you're like, hey, I'm not gonna pass. I'm not gonna hang out tonight. I'm kind of sick. I don't want to like get you sick.
Hey, wait. If I could stop you really quickly, the reason why you would do that, right? So the reason why you would avoid hugging people, the reason why you would try to keep your distance is because there is a risk. So that means you are slightly dangerous to another person if you have it, right?
You are symptomatic. If
you're symptomatic, okay, great. Okay, so
why should I be concerned?
Okay.
Do you think you should be required to let people know that you're sick before you hang? So do you think that, so given that, you know, it's your responsibility, I think that's the word he used, you know, to stay away from people if you're sick. If you don't, right, if you go out and hang out with people, should you be required to let them know that you have COVID? You know, given the danger that you're presenting to them?
Yeah, I will say again, before this whole thing started, if I was ever having a cold or anything, I people know, because I know you can get someone else sick. That's how cold was and how flu was before. You know, it's something that we tend to do. I don't know if people did not used to do that before, but I used to do that before. Now, if I am a sane person, I am healthy, why should I be denied to walk into anywhere where there's actually more people like me? I don't understand like why they want healthy people to not go into a place where, like, some places are so bizarre, they don't let you even into supermarkets unless they have a card. A card does not guarantee you're healthy. A card just only says that you obey what they wanted you to do.
Yeah.
Jeff, do you think it would make sense for them to like? Go ahead.
Yeah, I was gonna say the reason why is because they don't know if you're sick or not, and you also don't know if you're sick or not. That's the reason why.
Of course, I should know when I'm sick. That's what we have to do.
The issue is that I think you and I, not to put words in because that's you guys don't believe that you can be asymptomatic with COVID.
No. We have to clear that up. We have to really clear that up, because you cannot think that asymptomatic is someone that can pass the virus to somebody. As asymptomatic means it's a healthy person. It's just a term.
Wait. What do you think asymptomatic means?
Oh yeah, go ahead.
Asymptomatic is no symptoms.
Yeah, wait, you don't think that you can be symptomatic
to,
and can't be sick at the same time?
Asymptomatic is no symptoms. And I'm talking about someone who's sick or not. Are you sick or not? Do you have symptoms that you're sick? And we're talking about a cold or a flu.
Yeah, but wait, you can have a disease but also be asymptomatic.
No, but we're not talking about any disease.
Wait,
not talking about
SARS-CoV-2 is the name of the virus, right?
You can COVID or flu.
Wait, okay, hold on. You can have the SARS-CoV-2 virus replicating in your body and you can spread to other people while you're asymptomatic, right?
No, that's not true.
Okay, that's true. That's true of literally.
In our bodies, we have thousands of viruses in our bodies. Our natural bodies have viruses. We are the human body is that way.
No. Hold on. You fundamentally don't understand. Okay, there's a difference between a viral particle being somewhere versus a virus actively hijacking and replicating inside your cells in your body. Those are two different things.
Yeah, so if you were to breathe on somebody, kiss somebody, whatever, right? You would still have the infectious the particles in your saliva that you could spread to another person, right? So even if you have no symptoms, so really quickly, you are still a danger to people. I think we should be honest about that.
Okay, Gootecks, you were shaking your head too. Do you feel like a person can be asymptomatic with COVID?
I guess you could be asymptomatic and then get symptoms. I guess that's possible.
No, you can just have no symptoms. How do you guys understand this?
What? No. It's sorry. Let's not be condescending, if we can, please. I know it's frustrating.
He said it was a mistake to use the term asymptomatic.
You understand? You can literally have cancer and be asymptomatic. You know that, right?
This is not about other diseases. I said it. It's not. We're talking about COVID, not about cancer.
You can have HIV and you can be unsymptomatic.
Because your body getting sick. Your body getting sick is a reaction towards the viruses in your body trying to get out or whatever. If you don't have any of these symptoms, that means you don't have any dangerous viruses.
Wait, what do you think? Wait, hold on. No, wait. Oh God, I want to know this so bad. I want to know what it means. What does it mean when the body gets sick? What do you mean when you say that? The body gets sick. What does that mean? Where do the reactions in your body come from? From the virus trying to get out, you said?
Your lower immunity. If your immunity is low and you get sick, you can get sick if you don't take enough nutrients. You can get sick.
Okay, so hold on.
A normal person can get sick.
Okay, so let's break.
Our body to get rid of that is in the form of viruses. That's how we fight them.
Okay, hold on. So really quickly, no. We're gonna break this down really quickly just to make sure, because I feel like we're talking past each other.
We're not talking past each other. They just don't understand. But sorry, go ahead.
Okay. Well, there's two different different ways to use the word asymptomatic, and I think I understand what you're pointing out, Geisha. What you're saying is just that the word asymptomatic, literally means without symptoms, right? And that's what that word means. However, there's also a way that we're using asymptomatic where we're referring to someone who is sick with something, who does have something, but doesn't have symptoms. Right. So, for example, when you look at something like HIV, right, where people have sometimes had HIV for 10 years, but there was no symptoms and no whatever, but the virus was in their body and they were capable of giving HIV to another person. So if they didn't have any observable symptoms, they would be asymptomatic while still carrying the virus. And so when we're saying, can a person have COVID and be asymptomatic while still carrying the virus, I think that's what we're contending with that. Not meaning that they're just the general usage of the word asymptomatic in the way that you were using it, which is valid.
We're not talking
about a person. What we're talking about is a person having the virus but not having any outward symptoms. Do you think a person can have COVID? We can identify the COVID virus in their blood, but that they're not sneezing, they're not coughing, and they're not showing any other signs. Do you think that can happen with anyone?
We have viruses in our bodies.
Wait, no. But the specific. Wait. I'm sorry. Just wait. Really quickly, Geisha. I promise you, I'm gonna let you go. But just really quickly. I just want to make sure we're talking. Can you have the specific COVID virus? COVID, because when you want to identify a virus, you have to be able to look at the genetic sequence of it to identify the virus. Can you have the virus itself, that's COVID, that has the same genetic sequence as COVID in your body and not have symptoms?
That's possible.
Okay, so you can, and so really quick, if a person had the virus in their body and didn't have symptoms, would it be fair to call that person asymptomatic?
If the body is what?
If a person has the virus, like the thing that we're talking about, where you can have it, you said it's possible. So
no
in those, yeah, they have
no
no symptoms, but they do
It's
have the
asymptomatic.
virus in their body.
Yeah.
Would it? So then those people would be called asymptomatic.
Yes, correct. Yeah.
Okay.
And they spread COVID.
They are asymptomatic. They don't spread COVID.
Wait, hold on. So we have a really famous example.
You see, okay, I'll just be very.
It's okay. Let Geisha respond.
You see the human being as somebody who's just out there shredding everything to the world. We're like, let's just say our biology-wise, we're just full of germs and whatever.
No, Geisha,
hold on. Wait,
Dooby, hold on. No, Dooby, you don't understand.
One second. Let me try one
Hold
thing.
on. Look, I know it's frustrating, but this is a conversation, and I definitely really pushed her pretty hard. Let her speak her point, and then you rebut. Please take the notes. You're extremely good at it.
Okay,
Please let her
waiting.
finish. I know it's frustrating.
I have to do it before Dooby runs defense for these horrible.
I'm not going to run
points.
defense. I'm not going to run
Destiny,
defense.
Geisha, then Destiny, then Dooby.
Okay,
Go ahead.
thank God.
Why do you want? You want me to see the human body as someone who just I don't even want to be close to because it's just full of germs and viruses, like people who with phobia to this stuff kind of is. So technically, if that is the case, then nobody will leave their homes. Is that what you're saying? Because a person without any symptoms who naturally carries these different types of viruses in the body as a natural way to react to our bodies, like to any sort of bacteria or anything. That's what's going on in our bodies. And then you want me to feel that the way my body is naturally is a threat to other people? Because that's when we're not really thinking about how we're making this seem like to the rest of the world, how we want people to be scared of each other, how do you want to keep them in this fear that it's just being sold out. And there's so much propaganda about this. It's insane the amount of propaganda that we're seeing about that. And I just want to be very straightforward about it because I know there's a lot of people getting paid to talk about this stuff, to spread news
Okay,
about
this is it.
stuff.
We're not even on topic anymore.
Yeah, that's just so bad too.
Okay, so just to be clear, because Geisha doesn't seem to understand this, and maybe other people in the audience understand this.
Let's keep promoting the vaccine.
There's a huge difference between having a virus or a germ in your body versus having an active infection. When we talk about somebody being asymptomatic with the disease, don't say exactly. You don't know this, okay? I'm explaining this to you, okay? When we talk about somebody having a disease, right?
Please, let's keep it conversation simple, please.
Then tell us not to condescendingly me, okay? COVID-19 is what we call the disease, okay? The virus we call SARS-CoV-2, all right? When you have an active viral infection, okay? Viruses...
That means you have symptoms.
Wait.
That is not true. Wait, she interrupted me. You're going to cut me off now?
No, hold on. Destiny, just chill.
You have an active infection. You just said it.
Wait, Geisha.
How do we show up as an active infection?
Hold on, Geisha.
Okay.
Please listen. I really did stop to let you talk, and I made sure that Destiny waited. I really need you to be quiet and let him finish, please. Go ahead, Destiny.
An active infection means that there are viruses in your body that are using your cells, that are hijacking your cells, that are producing more viruses. That does not mean that you are necessarily symptomatic, and that does not mean that you're not spreading the disease. You can be infected with something. That doesn't just mean a virus is floating around in your gut somewhere. It means it is actively hijacking your cells and producing more viruses, okay? You can be infected, and it can be spreading. It's in your lungs. You can be breathing out to other people, but you might not be exhibiting symptoms of it. This would be an asymptomatic infection, and asymptomatic infections are still transmissible from one person to another. It's not as likely as somebody that is showing far more symptoms because their viral load is often much higher, but it is still possible, okay?
Yeah, you just...
Wait, hold on. Okay. So there's a really famous example of someone who was asymptomatic, infected a lot of people, and actually killed a lot of people. You can look up Typhoid Mary, right? Mary Mellon, who in the United States was responsible for as many as 53 people getting typhoid fever. they were puzzled as to why people who were eating the food that she made were catching typhoid and dying, because she was an asymptomatic carrier of this infection. So she was still able to give her clients, her customers, this disease, right, that got a lot of them killed. But she had none of the symptoms, right? And she had to live her life in quarantine and isolation when they found that she was the reason they were doing that these people were dying, even though she wasn't exhibiting any of the symptoms of this disease that she had, right? So we do know that asymptomatic people can still infect and kill other people, right? And we can find many famous examples of this. So like I said, Geisha, I sympathize with your desire to make your own decision and not to have this force on you or whatever. But when you make that decision, I think you need to be honest with yourself, right? That if you are an asymptomatic carrier, you are putting other people at risk. You could kill other people, right? And I don't want you to be COVID Geisha, right? I want you to go into this as informed as possible. Right? And the reality is that asymptomatic people can and do infect other people and can kill them.
Hey, I want to push back really quickly.
That's happening. It's the only thing. Like, the vaccine is not stopping people from being asymptomatic carriers. If that's it still continues being the same.
Actually, you're more likely to be asymptomatic if you're vaccinated, because your immune system is having such a successful response against the virus. So as your immune system is fighting off the virus isn't able to get a hold of your lungs to the point where you start coughing, right? Because that's how the virus wants to reproduce. So the fact that you're not coughing, but you still have the virus actively trying to get you to cough so it can reproduce at an even greater rate to project out the virus. The fact that the vaccinated, those of us who have taken the jab, have that immune system that can fight that off so successfully. So even if we do get infected, there's a greater chance we're going to be asymptomatic because of that, which is going to
Wait, hold on, Geisha. I got you. Listen, this is, I think, of the point that maybe you're trying to make, and I totally agree with this, and I think this is fair. Asymptomatic people are less likely to transfer the virus, right? Because of the fact that with asymptomatic people, there's less sneezing, there's less coughing, and so it's not as easily transmitted. But if you directly come into contact with saliva and things like that, or bodily fluids, then you have the chances of catching the virus, but you're not going to get it just from whereas everyone else, there's much more spittle, sneezing, coughing, and fluids that are leaving from the body. And I think that's where, so maybe it might be safer to say that you're less likely to spread it if you're asymptomatic.
True.
You're much more safe, but you are still possible to transmit the virus.
True.
Do you agree with that, Geisha?
Well, what I saw was that apparently people who have been taking the vaccine seem to have lower immunity. That's one thing, and that's what I've been seeing.
But that's a different topic, though.
Have a different perspective from other documents and other studies, and that's fine. But I've seen that apparently with the more they're boosting themselves, it's fighting less the virus, and they're saying that our immunity of people who haven't had a vaccine, it's actually better. And I'm not just not just making that up. And then also we are okay with we can donate blood, and that is also not the fact for people who have taken the jab. I saw also doctors saying that there is a chance of lowering the pH in the body of the person that has taken the vaccine. And I'm just saying, I do try to see all the different, because there's a situation where you have different doctors, different people having different studies, and some are just constantly just saying that this is okay, that this is good, and then we have people saying, well, we have seen this, and these are where we're seeing the results, and we're seeing that people are fighting better when they have and there are more people hospitalized when they had the vaccine. So how come is it that you're fighting it more, or that you're resisting it more, if that's not what we're seeing? But anyway, everyone has to look for themselves to see what's going on.
I just looked really quick. You can absolutely donate blood if you've had the vaccine. That's one of the many things you said. There was a lot.
I saw that the plasma is not good for COVID though, for helping patients with COVID to fight COVID.
Well, I guess I could Google it while you guys continue the conversation. Really quickly, Gootecks. So
actually, real quick, that when you say I can Google it while you do something, a lot of people have a certain worldview because they use Google exclusively for searching for search results, and I'm positive none of you guys are going to believe me, but there might be people that are listening or watching that can that maybe are on the fence. But if you use a search engine like DuckDuckGo, you're going to get wildly different search results than you will on Google. That's just reality. Now, what you choose to do with that information, what you choose to do with that information is up to you. But you should be aware that the results are wildly different. Especially, I mean, for things that are like remotely controversial.
Sure. So when we have an example like this, when we're dealing with like, are you prevented from donating blood if you've taken the vaccine? We can get the different results, but we would have to go to a law or a prescription put in place by like somebody like the Red Cross and see what they have to say. If they say no and they have nothing actually listed,
they're not preventing you. They're saying that they cannot use it to treat COVID patients because it doesn't work as efficiently that someone.
Wait, you just said people who have the vaccine can't donate blood.
She's saying that like use it to donate blood to treat COVID patients. I don't know what that means, but
they're not going to use it because it's not useful for what they're looking for. They need the plasma.
Wait, who's donating blood to help COVID patients? Is this a thing?
Yeah, we can look it up. But yeah, they plasma has been one thing for a long time that they were using to help people with COVID.
Are you talking about it was like antibody, like plasma stuff, not just like blood transfusions in general?
Yeah, what I'm seeing right now on the COVID-19 on the Red Cross, it does seem like there is some what they're referring to, I guess, a small little period for, in some cases, of deferral time for individuals who received a COVID-19 vaccine, but it's not like anything long term. But there does seem to be like, I guess, not for most cases, but there does occasionally some deferral times. If you just go to their website, I got here from Google, but.
When you say deferral time, that means they're not actively infected when they're donating blood, right? You have to like wait a period of time before you can donate.
Waiting a small period of time before you can donate.
That's fine. That's not being prevented from donating blood if you've gotten the vaccine.
Yeah, it seems like the deferral time is directly related to the symptoms, because it says in most cases there is no deferral time for most cases there is no deferral time for individuals who receive a COVID-19 vaccine as long as they are symptom-free and feeling well at the time of donation. So you have to just provide like your card and all that stuff. So it does seem like they are able to do it after a while. It seems like.
Yeah. That just seems really important, because if you say something like, oh, if you get the vaccine, your blood is so bad, you can't even donate it anymore. It's trash blood now. We can't save people with it. That seems like a huge claim to me.
There was a doctor who did a test on the two different and same person before she got the vaccine and after she got the vaccine. And that's why we're seeing the blood flush issues with some of the vaccines that got taken down. But what she saw was that there was more, like the red blood cells were more compressed. And if you're seeing a reaction, it's up to you to go to the doctor and go check and see how your blood's doing and how your blood pressure and all kinds of things are doing, because we shouldn't be, I feel like it's okay for people to just feel concerned and be like, let me just see how my health is doing, because that's the only reason why I speak about this, because we shouldn't be afraid of speaking out about our concerns. And then that there's this now that you cannot say a word, or you get terminated, or you can shadow ban, or you can, for example, most of the groups that were vaccine injuries got eliminated from Facebook, and then now they had to go to Telegram. We're talking about hundreds of thousands of people in a channel sharing their experience, and they're like the people that have been victims, the people who have been injured, those who have been lost. Like, they share it in this channel because they've been kicked out every single time they try to speak out on other platforms like Facebook. It's why we're making such a horrible thing to just say, hey, I'm concerned about my health. It's our health. I don't know, I'm not here to try to disagree or agree with anything. It's I'm just here to say, I am concerned about my health. You don't need to convince me that what they're doing is right. I have the right to say, I'm concerned, I'm seeing this, I'm sharing with other people, I'm speaking out with other people, I'm researching myself as well, I'm talking with doctors. I constantly have people that I talk with, like scientists and doctors, about this stuff. And I have the right to do so and to think for my own too, and see both sides. It's something that I highly encourage people to try to do on their own.
But so again, I have empathy or sympathy for that position, right? But take Trihex for example, right? So you're concerned about your health, right? Because you have questions about the vaccine, right? You think, but could you understand that someone like Trihex or somebody like me, I've had like I think like 3 family members die of COVID, right? Maybe I'm concerned about my health, my family's health, right? So, and given that you're on here stating that asymptomatic people can't spread the disease, can't spread COVID, we know that's not true. That you're on here said that natural immunity is better. We know that natural immunity. I think that only happens in like 1 out of 3 of the cases where someone gets COVID, right? And only 1 out of 3 of those cases do people develop the antibodies needed to protect against future cases of COVID. And even in those people, that falls off after like 6 months, right? So even if you've had COVID before, right, 6 months later, you're less protected than somebody who's gotten the vaccine. So the current research, as it is, says that the best thing to do is if you've had COVID before, get the vaccine anyway, because your antibodies have dropped off, and you're going to need the boost to boost up the efficacy of the antibodies again. So that's how it currently is. So you being on here, spreading, I'm not going to say that you're lying, but the information that you're giving out is incorrect, right? It's not true. So someone like me or someone like Trihex who might be concerned about my health and with the health of my family, with the older people in my family, the health of children who currently can't get the vaccine in the United States, right? Because it hasn't been approved for children so far as I'm aware, right? Why isn't there an argument from their position to say that you shouldn't be in public, that we shouldn't allow you around our children, we shouldn't allow you in places where old people might be or people that are at risk might be?
One second. Wait, Geisha, really quick. Gootecks, you seem to disagree with that. What was your primary disagreement with what Dooby was saying?
I think the part that I think a lot of you guys are missing is that, like, I think me and Geisha both totally understand you guys' positions. Like, we totally get it. Everything that you guys say totally makes sense when it comes to protecting yourselves and protecting your family members. It all makes sense when you look at everything from one perspective. Like, if that's the only information, if that was the only information that we had, we would think of it the same way. But the difference is that I think we are basically experiencing or living in like two wildly different realities. And I'm pretty confident in saying that because I didn't start out thinking about it this way. When this first happened, like, I thought we were all gonna die too. Like, I really did. I was scared shitless. But over time, through doing the research and taking in information from different sources, I changed my view. So I think it's unfair to say that we're like inconsiderate or don't empathize with your concerns. We totally do, totally get it. It's just that the information that we've found over the years now has just led us to see it differently. And I think that's the part that you guys completely miss.
I think to be clear,
hang on.
Trihex had his hand up. Let Trihex go first.
Yeah, it's a simple thing here. Okay, so like what you're going at right now, Gootecks feels like a very like anecdotal point of view, because like if we just look at like year over year death and the spike in like reported death in just United States alone here, like then in that case, what's the correlation there? Like if we have 830,000 Americans dead on the formal number, which is very obviously underreported here, like I guess you have to agree on the stats in the first place, but like if there's an increase in death definitively, then like what are we to conclude then if this is not a situation to deal with? Like you're undermining the consequences of the pandemic at this point, are you not?
There were less deaths overall in America in 2020 than there were in 2019. Just overall.
We're not talking about just deaths. We're talking about excess
That's not even
deaths.
true.
And I don't even know if that number is true. I think the issue when we talk about like doing like research, like if people did their own research, that would be great. but nobody's actually doing their own research. I don't even think you're using DuckDuckGo as a search engine because it's not going to give you wildly different results than Google. I've used DuckDuckGo before and other VPN search engines to see, because sometimes I'm curious, and I've walked through another guy that was into conspiracy theories on stream too. It's like, oh, well, let's try to use another search engine. You don't come across these wildly different results. You're going to get information from government websites. You're going to get information like posted on other mainstream media sources. It's not like DuckDuckGo magically censors the FDA or magically censors the CDC or CNN or whatever. Those search results are going to show up. Also, when you're staking out these really, really, really strong positions on certain things that are contrary to all of the mainstream opinion on this, but then like you don't know anything about those opinions you have. For instance, like what a VAERS report is, despite like very confidently asserting that it could be used to track, all of these coronavirus vaccine anomalies, it makes me wonder what type of research you're doing. It feels less like you're doing research and more like you're just getting a media spin from another source.
I mean,
wait, really quickly,
I don't know. I love the way that you try to make me look stupid because I don't have a good description for a VAERS database report. Like, I've gone to the database and I've looked through it. I'm like, wow, this is really extensive. You have to like report all these symptoms. You have to, there's like, it takes a long time to fill out. Right? Like I've actually gone and looked to see, because I wonder too. I'm like, okay, well, if these are all self-reported, how easy would it be to fabricate like all of these reports? But it is quite time-consuming. It doesn't
have to be fabricated. I don't know why you don't understand this, right? There are 800,000 heart attacks every single year in the United States. If somebody has a heart attack after getting a vaccine, that might get reported in VAERS. It doesn't mean the vaccine caused it, though. This is you're like, the thing that's the saddest about this is that there are so many great tools that are available, but because of people like you, I think we have to get rid of them. I don't know if it's responsible. I don't know if it's responsible to have.
Hold on, Destiny, just a second. Like, look, up till now, man, we've been having a conversation and it's been going really, really well. Your points have been made. They're making their points as well. Like, we don't have to like let's try.
I'm not being. I'm just giving a fact. There are some things that our media environment has shown us that makes it so that maybe there are certain tools that shouldn't be publicly available anyway. Preprints are another great example for frauds that want to push things like hydroxychloroquine and ivermectin. The biggest bolster that these medications got, these bogus medications don't work, are from preprints, right? And VAERS being publicly accessible, maybe it isn't a good idea because a lot of people cite VAERS without having any fucking idea what it even is. We've seen it happen in this very conversation. And I think there's a valid question to be had there, or a valid conversation about should these tools remain public or not, because they're just hijacked by people willing to spread misinformation or conspiracy theory. They don't understand the application of any of these tools.
All right, well, this well might be a little poisoned, but let's...
I'm not poisoning the well. I'm talking about what's happened in this conversation. These are valid conversations people are having. What do you mean?
Just because something is accurate doesn't mean that it's not that it's beneficial for the conversation. But what I did find, thanks to this guy named XO Anderson, he did link me something on the Wayback Machine, aka the Internet Archives, in which it detailed that they did at one point say, if you receive any type of COVID-19 vaccine, you are not eligible to donate convalescent plasma with the Red Cross. So there were some, I guess, at some point, and I think I think what this demonstrates is that what Geisha was saying earlier, maybe that might not be the case now. There was misinformation happening about the coronavirus on both sides, and sometimes it wasn't necessarily misinformation, but it might have been just a hesitancy and a reluctance just because of lack of information, where we were saying we're creating certain barriers until we get more information, which is why some of the more stringent lockdowns in the beginning and just other things about like, oh, it might be just airborne. We didn't know in the beginning. We all needed to learn more information. But Geisha, what this does demonstrate, if we look at the same Red Cross website now, and they are saying that you can do it, I get where you had the information originally that you could not. But I guess now, this conversation, thanks to XO Anderson, helped us to learn that this was a thing in the past, but it's not the thing now. You can donate, just for future references when you're talking to people about donating.
Okay, what do we think that convalescent plasma was for? Do we understand what this was even about?
I don't. I just know that this was a...
Do Geisha or Gootecks have any idea what this is about? Okay, so my understanding is that early on in the treatment, when we were trying to find different ways of treating the coronavirus, the idea was that we could take plasma out of the bodies of people that had been infected, and then we could use that plasma and inject it in other people in order to help mitigate the symptoms of the disease, to cure it earlier. That was essentially the thing. It wasn't about your blood being tainted. It wasn't about your blood not working. It was the idea that early on, we didn't know whether or not the vaccines produced enough of an antibody response that drawing convalescent plasma out of a person that was infected would actually be a good way to cure somebody with the coronavirus. Now, Now, all of this actually is irrelevant because convalescent plasma treatment isn't even used anymore because it's not a good way to treat it. We don't even do it anymore. We did the research on it, now we don't do it anymore. But that's what that original, that's why I'm just now connecting this. I didn't understand what you were talking earlier. I thought you were saying you didn't like draw blood or you didn't do blood transfusion for people with the vaccines. That's not true. We were talking specifically about using convalescent plasma as a treatment for people that had the coronavirus. But we don't even do that anymore because it's not a good treatment.
AuGrimace was talking about if this was blood, and I said this is about plasma. I spoke about the plasma, and they're not using it anymore, maybe because of the same reason they don't want to use hydroxychloroquine or ivermectin. It's the same thing. I was like, let's just not use the things that can help, and then just say that the vaccine is the only way people can, I don't know, feel better or do whatever. Plasma is something that has been used widely because, you know, like I said, they take it, your body antibodies, it's you already being infected, and yada, it goes that way, and it's not something that is old or like brand new or we've never seen this before. And I'm really surprised that you're saying that they're not using it anymore, as it really just makes me feel even more, concerned about the hierarchy of pharma and who decides what we can use and what not to use. Because plasma is something that works.
How is it that every single country, company, and academic institution in the world can come together on this conspiracy theory?
Single one? What about everyone else that's being censored?
A doctor, a single person, is not a country, company, or institution, like a university.
A lot of people that are
A lot of people is not a country, a company, or an academic institution. Do you understand that? Okay.
Wait, so Geisha, like some of the Fauci stuff, right? So, or the confusion about masks early on, right? Why couldn't this just be a case of like Destiny said, them not being sure about whether or not they could use this plasma this way initially, and then as new information came out, as they did more research and more studies, they adjusted their position with the new information, and now they have another position, right? So it could be something as simple as that. Like I don't know if there's any, I don't. So far as I'm aware, there's no evidence of any conspiracy, and kind of like the moon landing conspiracy, a conspiracy this widespread across the entire planet would take a lot of people shutting the fuck up, right? And people don't like to shut the fuck up, right? So I think it's pretty unlikely that there is a conspiracy here that spans the entire planet's like governmental systems, right? So it's much more likely that they just adjusted the information with the new data that came in. So
that's possible. Go ahead, finish it.
Yeah. So again, I'm not for like mandating this right now, but I think if you are going to be hesitant about mandates or hesitant about the vaccine or any of the information that's out there, we got to be honest about what the current data actually says. Right, like that's the asymptomatic people can spread the disease. That if you've had the COVID before, you should still get vaccinated. Right, and again on the other side, we need to acknowledge that our understanding is evolving and everything's not settled just yet.
So I just want to point out really quickly. I understand where both Gootecks and Geisha are coming from with the idea that sometimes there does appear to be like a motivated reasoning almost when it comes to like new information in certain cases. And so I think while like we always have the idea of like trust the science and things like that, and I hear those quotes, but then there's sometimes where it seems like the science isn't being completely transparent, right? Like there's certain studies are being like, withheld or whatever. I don't know. I'm speaking extremely loosely, but specifically with regards to like, some of the idea that there could be other treatments and other possibilities that are being withheld, there's an obvious, like, we should be able to recognize that there's like a motivation from like specifically like companies like Pfizer and Moderna and things like that because of the billions of dollars that they're making on vaccines. So the suppression of that sort of information does somewhat make sense. Anyone think does anyone disagree that could be a possible motivation at all?
No. If you want to look at motivations, then you need to look at everybody's motivation. If it was the case that in the United States, there was a whole bunch of bogus science, then there are two huge places that we can look at for pushback. One, what about the EMA from Europe? Why wouldn't any European countries be speaking up and saying, hold on, the US is pushing a bogus virus on us, especially in some places, like it was in France with Raoul, their doctor there, right, that was trying to push things like hydroxychloroquine. There are other countries that will clearly come up and have their own treatments and say they've got their own plans for things. Why has nobody else spoke up against the United States? Now, if you want to say, well, the Western world and NATO and all of them are all in cahoots with the the US. What about Russia and China? Why haven't Russia and China stepped up and been like, well, look at what the United States is doing to you. Look at the bogus vaccine they're pushing. They have every geopolitical interest to do so. They've got all the security interest to do so. They've got everything that they stand to gain economically and influence-wise around the world. Why wouldn't they step up and call out the US on its bullshit? Or is there actually some global conspiracy uniting all of these? There is. Okay, Geisha, can you tell us about that? I want to hear about that. That's what I'm interested in.
Well, you've seen the World Economic Forum, how they get together and then discuss everything that we're going to do in the, in all the countries. And then how you have the United Nations also, where they discuss everything that they're going to do, all the agendas that they're going to do, the agenda that's, like for a couple of years from now, and how technically every single country does what, the same group of people kind of decide to do. So that is definitely possible because they have done that before. They have follow up with agendas. And they have on this type of thing that is they are passed by worldwide. Like
so what do you think they're trying to achieve with
no, we're not. I don't want to get into.
I do for sure.
I know what you're gonna say, but you know that this is something that they openly speak about. What like?
Okay, here's a question along this. So basically, if I were to show you any study from any country or from any company or from any school, you have the grounds to tell me that any single one of those could be faked then, correct?
You want to say about studies on universities?
Any university, any country, any company. You can tell me with good authority that, well, that country or that company or that institution, that school faked their study. You could say that, right?
If it's because you're saying that there are universities all over the world that can agree or not with, with certain studies and all of that, right? One thing I can tell you of what I know is, you can see that here also in the U.S., that the pharmaceutical, families that they find, I don't know, Rockefellers or what, one of the first things that they wanted to own was the universities. So they founded a lot of the universities. So that's, in a way, helps that their students learn about the same products that they are giving, so the same pharmaceutical products. So a lot of things, a lot of medicine what got replaced during the years, and this is something that isn't not just making this up. This is something that has happened. So they've been changing over time and just adding what they, because of course, if you control what people are learning.
So basically, there's literally nothing that I could ever show you that will change your mind. You're completely dug in. It's impossible.
I understand what you're coming from, but I'm learning that this stuff is happening.
So I'm just trying to reiterate. There's absolutely
no. Just a second.
Well, no, I just want to be clear. There's absolutely nothing that she could see that would ever change her mind ever, because every single institution is rigged against us because of the reptiles or JFK or some shit.
The point is to change my mind. The point really is to just find the truth of what's happening.
Well, the truth is what you see posted on Instagram and Facebook, because you can't trust any country, any company, any institution, but you can trust vaccine denier 6969 posting on Instagram.
Okay, hold on. Geisha?
Dealing with it, and I like how this Salvador is also dealing with it. They're doing a really good job with this. Not everyone.
Geisha.
Yes.
All right. So at this point, I feel like the conversation has gone so much further than like vaccines themselves, and now we're kind of into maybe some broader conspiracies, which I just don't think that it's really conducive to this conversation. However, what I will say is I do believe that like these sort of conversations are so incredibly important, because like the whole goal is to be able to find information, to hear the ideas of the other side, right? Like that's supposed to be the thing. I really, really would like to avoid as much like, condescension and attacking.
Wait, but you won't hear any information from the other side. You can't. It's all rigged.
Yeah. Well, so can I ask?
Wait, no. I get you feel that way.
No, that's what she said. It's not how I feel. She literally said that.
Okay, but at the end of the day, the information was stated, so the people listening, the people who are in the chat, the people in your whatever, the people who will see this in perpetuity, those people are being made aware. So what I would like to do is, I would say that if you want to be informed about the coronavirus, there are different places you can go to. Obviously, you can go to the CDC, you can go to the NHS, you can go to the common places where people get information and look at studies that are in, the Lancet and so on and so forth. Those things are there. But other people might feel like some of those places are rigged or biased or whatever. And so because of that, they might not want to use that. Someone provided me with an alternate source of information. I'm going to link it here. And you guys can check that out. But as Destiny always says, and as everyone should recognize, you have to make sure that you're leaving on your critical thinking hats whenever you're encountering information, because yeah, there's some people that just don't trust the government, but ultimately just make sure that you're vetting the information that you're encountering. Try to be safe. I think my thoughts on this topic is, for me, a lot of the motivation comes from being considerate of other people. And whereas I recognize that maybe I don't think COVID will kill me, I've had it, and I'm perfectly fine. I'm not probably the person that's at most risk, but people like my mother are. She's immunocompromised. So sometimes it's not necessarily about how well we'll do, it's about how well other people will do. So I think we should probably be considerate and make sure that we're doing everything we can, not just to protect ourselves, but to protect our fellow man. There's the information. I linked some stuff there. Obviously, I'm pretty sure most of these people are available. You can contact Gootecks or Geisha or Destiny or Trihex or any of those people if you want to engage in further conversation on coronavirus. I think sometimes these conversations, there are things that are very beneath the surface that are maybe underpinning these conversations. And I think, Destiny, you did point out that's what's happening here. There are broader conspiracies, and so then it is harder to like maybe unearth maybe another person's position. But all you can do is give them the information, hope that they'll like contemplate on it, and then they'll move on. If people really would like to give closing thoughts, please keep them as brief as possible. And yeah, we can go ahead and go to the next quick topic, maybe 20 minutes.
I'd actually just like to ask you a question, Geisha, if that's okay. You said that you believe that there's some global conspiracy, right, with all these major medical organizations. So, as Destiny said, that would imply that there's nothing that these organizations can put out that you'd believe, so long as the stuff they're putting out indicates that COVID is a problem or the vaccines can fix that problem. But on the other side, there are many organizations on this planet, as you can see in the 2016 elections in the U.S. and other elections around the world, I'm sure, that have an incentive to push disinformation to destabilize countries and governments and to make people confused and to harm people, right? So you're taking in information that's telling you that your government is lying, for example, or that the world governments are lying about COVID, right? So given that there are other governments and other organizations that have an incentive to push that kind of information onto you, and to confuse you and to misinform you and to get you to spread that information on platforms like this, how can you tell the difference? Like, how do you know that you're not being misinformed by the other side, by someone that has an incentive to fool you on this?
I think you should be an intelligent person to be able to tell what makes sense, what seems like just connect the dots yourself. I think, I don't know, like my opinion is if I am seeing something that is extremely sketchy and then something that they are saying out loud, this is not something that I'm like, oh, I'm just believing. They are speaking out loud of what they want to do, how they want to do the research, how they want to do this, how they want to do that. They're just speaking freely about it. So a lot of times we want to make it sound like this is something like, oh, we are thinking that they're plotting to do this stuff. Dude, there are books about how this whole thing was going to like happen and all the steps, and I remember having a lot of documents about how they will use the media to talk about it and like spread like whether it is a shaming, using a lot of shaming techniques, using a lot of things to like promote, to like make the people take the whole like vaccine thing, the whole thing, like to make an ID. All of that has been on like for a while, but then we want to, some people will say that, oh, you're spreading misinformation, but like then who is deciding what is this misinformation? Who really?
Well, that's kind of what I'm asking you.
Wait, hold on. These were supposed to be closing thoughts. We were supposed to be moving on. I didn't really want to engage into a further conversation. I'm going to take that as both of you guys. I don't think everyone needs to give a closing thought if they don't have one, if they feel like everything that needed to be stated was. But is there anyone else who feels like they need a closing thought?
Yeah, I'd like to give a closing thought. It's really, I know you guys are trying to empathize with us earlier about how you understand where we're coming from, but try to think about where we're coming from. Whenever we hear like all of these outrageous claims, one after another, like just listed off every single week, it's a different claim. Even like through this conversation, we've gone through the whole, like, you're not allowed to donate blood if you've gotten the vaccine. And it took me a while to find this study that was put out forth in Germany showing that there's increased risk of like destroying your blood cells. Just looking at this, I see the people who like conducted it were like the medical equivalent of astrologists doing like seances or something to come to the conclusion. And when we actually put that data in front of a hematologist, they say, well, this is the sort of damage we can expect when somebody's had too much protein. Like, this is not like some like out of a novel experience with the blood cells. That there's nothing. And then if this was actually occurring, we could reproduce it like locally here and come up with that data and say like, actually, yeah, this is a problem. But like, it's impossible to, because at the very surface level, this wasn't a problem to begin with. But like, we still have to deal with this every time, because every time it's a new claim, and it's frustrating because like, if everybody just got vaccinated, everybody put up that barrier and we all work together, we can mitigate so many deaths across the entire country. I mean, now it doesn't really matter with the endemic nature of it, but in the beginning, when there actually were people dying of this, at a pretty regular rate, it's so frustrating for us to deal with that. And when the next pandemic comes around, we know we're going to have to be dealing with this again. And when we could actually be putting up barriers and actually like coming together as a society and actually pushing back against this stuff. And so like countries aren't actually incentivized to actually send a bioweapon to America, because they know that those people don't give a shit about the truth. They'll say whatever they want for whatever amount of money, and there's no way that they'll actually operate on a single issue together.
Even if I still got vaccinated, they will still pushing that I need a second one. So it's really a, like, even I know your frustration of like, we wish things could go back. We deserve things to go back to normal. But if you see,
wait, I'm sorry, I didn't realize I was muted.
And then they will too.
Geisha, hold on. I'm sorry. This was not supposed to be a debate. Like, I will do, because you guys were the minority in this conversation. You guys will have the final say, right? Jeff, do you have something?
Yeah, I want to give. Yep. Two things. One is that the human mind is very, very powerful. It's very good. It does a lot of things well. And one of the ways it works against itself is something called motivated reasoning and confirmation bias. If you go out with information in mind and you go searching, I assure you will find plenty of information that will coalesce with what you're saying. One of the things you need to do is very much be willing to see information from both sides. I mean, that doesn't mean that you're going to believe both sides, but you need to be able to see information from both sides, and you need to have some method by which you kind of eliminate information. So what Gootecks has said is partially true. If you go to DuckDuckGo and you do searching, you will find different results, but that's because Google has spent tens of millions of dollars for decades curating and ranking and having all of their information that they group, put across the internet, and whatever their algorithms are, that's how they choose them. DuckDuckGo is something else. They're going to have their own style. So the ordering of information is what's going to change, but the availability of information that Destiny mentioned is not going to change. Something might be on a little bit lower than the first one. It's important that you go and look for information. It's important that you find it. Another thing that I would just highly recommend is really making sure you understand what media literacy is. Not every source of information is valid. Not every source of information should be listened to. How exactly you determine what should be and shouldn't be disregarded is the hard part. It is a challenge. And the more education you have, and not just like to kind of suck off collegiate education, the more education you have, the better you kind of become at it, which kind of makes it seem like circular, like, oh, all the people who are in the academic field, they're all agreeing with this thing because they bought into it. But it's kind of, they've learned a skill set on how to parse information, and when they're looking at the information that they find trustworthy, they've come to a conclusion. Yeah, that'd be kind of my last say on that. I can't really tell you to get vaccinated. I mean, I would greatly appreciate it if you got vaccinated. I mean, I'm sure you guys have made your own opinions. You guys have found your arguments for them. I would say if you find yourself in the corner of you have a whole bunch of information, and any information to the contrary is immediately disregarded, I would say take a pause, take a look at some information, because there's no way that everybody on the other side's wrong. Because there's usually some information on the other side.
I appreciate that. Thank you so much. Gootecks, do you have a closing thought?
Yeah, I think Jeff makes a lot of great points, especially about media literacy. For example, me personally, what I do is I listen to the No Agenda podcast, which is about 3 hours of media deconstruction twice a week. So for me personally, like that's what I do. But I guess to close it out, I think that these types of discussions, even though we largely disagree, I think are really important to have. And despite the disagreements, I think because there's so many instances on social media of the censorship or removal of different ideas and opinions are kind of why we're in the situation that we're in overall. So even though we disagree, it's still useful and beneficial to have these conversations.
Thank you. I appreciate that 100%. And Geisha, there are a lot of people have some strong words for you. Do you want to get your final thoughts before we
No, I really appreciate the time that everyone, is adding to share here. Like he said, also, Gootecks and Jeff, like even myself, like this is not something that has been just one-sided my entire time. I was there, like I was in a time where I was wearing gloves and like everything, and like going to the supermarket, like just like, I was there too. It's not like I don't need people to try to convince me to believe on something, because I believe that we should, we should research and I don't want, because now apparently now even researching is a bad thing. Now there's people that are discouraging you from like trying to see what's going on, to ask questions. Now there's like categories of what is okay to research and what's not, or like that you're not good or you're this, or like we just need to let people like I feel like a little less passive aggressiveness toward each other, like just sitting and listening to each other and understanding how everybody feels it's important, and caring, because I don't know. I feel like we will get through this, but we need to work on how we respond to and react to things, to sit down and like talk things out.
Absolutely. And I'm trying my best to help this space be one of those spaces where people actually have conversation. Obviously, it's very incredibly unpopular to be anti-vax in any capacity. So I do absolutely appreciate both of you guys for being willing to have this conversation. And I appreciate, Destiny and everyone else for even having the information that they have to be able to counter whatever they felt they were hearing, so that at least both sides are being expressed. Any individual narrative going forward 100% without any opposition is incredibly convincing, which is why it was so important for me. I felt that certain people were particularly capable in being able to, combat some of the ideas, and I appreciate those who came to be able to do that. Second topic. I mean, we're not gonna do a full hour or 40 whatever minutes left.
I think Trihex might have wanted to say his piece.
Oh, yeah, I give yours. I'm sorry, Trihex. Go ahead.
Am I allowed to give a close before we move on to this topic here? Yeah, I just GG's to everyone, etc. Here. The if anything out of all this here, I wasn't really. I figured I wasn't gonna be able to really sway anyone over from the anti-vax side into maybe coming into more vax skeptic, vax hesitant, or coming into pro-vaccine. But what I probably found the most jarring here was this notion that asymptomatic spread is a myth. And I know we're not doing any more debate rhetoric here, just more that I hope that we are able to come to a capacity point where we can realign the vax hesitant into, like, at least, if I won't convince anyone on getting vaccinated on that front, on that, but if we were able to come together and understand better that the asymptomatic spread of COVID is real and it's going to prolong the duration of the pandemic, and being able to do every action within our tool set to mitigate the spread, it will get us over the pandemic ultimately and save lives, including possibly yours in another timeline. That'd be great to have see done. And man, I would and just the other thing is, again, closing statements, right? Just the notion that having a healthy lifestyle alone is enough to fight against COVID is something that we definitely got to combat here. This is some surface level Joe Rogan nonsense that is just simply not true. We have documented evidence of people who were super healthy, bodybuilders even, who completely were COVID deniers, full blown here, who succumbed to COVID and then died. And the idea that you can just throw the kitchen sink, quote unquote, at COVID with everything but the vaccine, whether it be Regeneron, antibodies, ivermectin, many of those substances are not natural at all. And it's like it's just what I don't understand why we're going around this technicality of the taboo of just admitting here you're going to do all these other long form, much more complicated, less successful means than just what's already been proven now with, again, millions, if not billions of doses. So I wish y'all luck. I hope you don't have to tour an ICU ward at some point in the wrong sense. And let's keep working towards the solutions, I guess, at this time.
Absolutely. Okay. That was a really heavy one.